All right. Thank you, everyone, and good evening. Welcome to the Lewiston City Council workshop and special meeting for November 10th. A few quick items regarding meeting logistics before we get started. This session will be conducted remotely and council members will only participate electronically. For those viewing online, please ensure that you join this meeting using the following website: www.lewistonmaine.gov/2020cc. If you join this meeting using any other link, you may have trouble connecting properly, and we encourage you to rejoin using the web address that I just provided. Public comment on any item appearing on the agenda may be sent to public comment at lewistonmaine.gov prior to or during the meeting, and all comments received will be forwarded to the City Council. Members of the public who are logged into the meeting online can make a comment when invited to do so using your raise hand button in the lower center of your screen. Once you are acknowledged, your microphone will be unmuted and you will be invited to make brief comments. Speakers will also need to ensure to unmute their mic as well. And councilors are asked to raise their hands when they wish to make a comment. With that said, we'll start our 6 p.m. workshop, which is Community Recovery Grant Update. And I believe Catherine Ryder will be the presenter, and she'll have several folks that will be with her that she can introduce. So if we could bring in Catherine. Good evening, Catherine. Good evening, Catherine. Can you hear me?
I can now, yes. Hello.
All right. Hi, good evening. So if you would you introduce the folks that are here with you when you're ready? And I see Dale has brought them all live, although I believe you brought Andrew Rice, Dale, as well. All right, Catherine, whenever you're ready.
All right. So I was told by Dennis that I can screen share, so I'll go ahead and open up my PowerPoint. Make sure you can see that. There we go. So the project that we'll be talking about tonight, and I will introduce the folks on the second slide, just as a reminder, is community recovery. And you'll note that unity is all in bold print because we firmly believe it takes all of us working together in order to create a recovery-ready community. This project was a funded grant from the Maine Health Access Foundation. It was 3 years. 2 years of that time was for planning purposes, and the third year was a year of implementation. And that's what we will be sharing with you tonight, is the progress that we have made. So tonight's presenters will include myself, and for those of you who do not know me, I'm Catherine Ryder, and I serve as the CEO at Tri-County Mental Health Services, where I have been employed for 29 years now. And I also have served as the project lead for this particular grant. Also with us is Dr. Paul Vinsel, and Paul is an emergency physician working at Central Maine Healthcare System across all 3 hospitals, Bridgeton, Rumford, and CMMC here in Lewiston. And he also works for us 10 hours a week as a prescriber in our opioid health home program. And then we have Detective Joe Philippon, who asked me to drop detective, and I just said it anyways, of the Lewiston Police Department. And he has been a pivotal component of our steering committee, along with Celeste Yakawanis, who is here representing Consumer Voice as a recovery advocate. And I wonder if we could just let them all say a quick hello and wave so people can see who they are.
Absolutely.
Hello.
Hi there.
All right, so moving right along, probably the single most, well, let me just back that up a little tiny bit. I've led a number of grants in my career here at the agency, several of them fairly substantial. We've had multi-million-dollar grants from the federal government and grants in the hundreds of thousands of dollars here in the state of Maine. And I have to say, this one scared me more than anything else that I've ever undertaken, both because of the breadth of the issue of opioid use disorder in our communities across the nation, the number of deaths and therefore the lives that we were responsible for, and also the number of individuals that I brought to the table to be part of this steering committee and to have direct impact on the work that we were doing. Normally we have collaborative efforts in a grant project, but never have we had this many contributing organizations. And we had CEO or high-level administrative endorsement from each of these entities. So to read through, obviously Tri-County, we were project lead. St. Mary's Regional Medical Center, and they were represented by Dr. Michael Kelly and Paul Rulo, the Director of Behavioral Health Services. Lewiston Police Department and Auburn Police Department, represented by both of our chiefs, and they likewise assigned staff to join us. Community Concepts, represented by their CEO, Sean Yardley. Central Maine Healthcare, a number of different people who have come to the table, and most importantly, Dr. Vinsel. That's how we met him and got involved with him, and subsequently stole him for 10 hours a week with the blessings of Central Maine Healthcare. United Ambulance and their community paramedicine program, and Dennis and Daphne Russell both have participated with us. Healthy Androscoggin, we've had Corey Brown and Aaron Gay at the table. Androscoggin County Jail in the person of Jeff Shute. The Maine Alliance for Addictions Recovery Executive Director, Darren. Androscoggin Home Healthcare and Hospice, and we've had a number of different folks to include Angela Richards and Michelle Couillard. Androscoggin County Sheriff's Department, our very own Sheriff Sampson has been at the table. Bates College, Professor Sam Boss, and of course Celeste and a few other folks who have represented consumer voice and have kept us smart, feet to the fire, always thinking about the impact on the people that we serve. So our goals for the project were to create a no wrong door opportunity for anybody who was struggling with an opioid use disorder. And this means that not only did we develop services in hospital and in organization, but we went to where they were on the streets, homeless, in encampments, at shelters, because we know that it takes a whole lot of motivation and courage to actually cross the threshold of an organization to ask for help. So sometimes planting the seed means we need to be out in the community, meeting people where they're at and starting that conversation, where they're most comfortable and where they feel safe. The goal of bringing together all the partners was to create a better coordinated system of care where we spoke the same language, we shared documents, we communicated amongst our organizations from a top down, bottom up, side to side, effort of making sure that everybody was in the loop and knew what we were doing. We had training for prescribers. So when we started this journey, we had very few what's called X-waivered providers, which is prescribers who can offer Suboxone to individuals who are living with an opioid use disorder. And we successfully trained over 50 prescribers in the final few years of our grant project, which translates to, and Paul, correct me if I'm wrong, at least 100, and I think they bumped the ceiling up to 200. Am I correct on that? 200 patients per provider after a year of being waivered?
You're on mute. Doc, if you could unmute yourself.
So, yes, Catherine, when you first get the X waiver, the first year you can prescribe for 25 patients. And after that, you can apply to prescribe for 100. And then finally, I think the final number is 250 you can apply for. That 25 and that number is the patients that you are continuing to follow. So if you treat a patient in the emergency department and give them a prescription, and then they're picked up by another provider for outpatient care, they're no longer on your list. So you have another 25 to go.
Thank you for that. And also a big part of our initiative was to elicit a campaign on reducing stigma, because we know that people do not come forward to receive services when they feel stigmatized. the issue of equity and access, which we know is a significant issue nationally at this point in time, has always been top of mind for all of the work that we have been doing across our communities, creating a recovery-ready community. And I believe we have established the foundation of that with support from all of you. We have come to City Council a number of times during the 3 years of this grant development. We've done that both in Lewiston and in Auburn, and worked closely with city leadership in both communities as well. And then ultimately, and the single most important goal, I believe, is restoring hope and saving lives. So the plain facts, this is a very, very difficult chart to see, and my apologies. This is drawn from Sam Hurley, who is our State Director of Emergency Medical Services and their data analysts. They are assumed to be the most accurate data collectors in the state for overdoses. And so if you look at this map, the green and the red dot in the center of it are Lewiston and Auburn. Lewiston is in red. And you can see since January 1, there have been 96 overdeaths in Lewiston, and Auburn is in green, and there are 29. The surrounding communities making up the rest of Androscoggin County, if you look out to Poland over here, 9. If you go up to Livermore, 8. 7 in Lisbon Falls, 5 and I think this is Lisbon, 5 in Turner, and then 2 and 1, and 1 here. So clearly, this is where the significant challenge is, and it's where we've been focusing much of our effort, although we are indeed serving the entire county and then beyond. Dr. Vinsel, I'm going to turn things over to you to pick up here.
Okay. I think the most important thing to note here is that addiction is a disease, and it's a disease of the brain, and I'll get into that further. It's not a moral failure on the part of the patient who's living with addiction. Down in the lower part where you see the nucleus accumbens, the hypothalamus, pituitary, that's all part of what we call the midbrain. That is the more primitive part of the brain, and it is part, the pleasure reward system is there. And drugs that people use affect this pleasure reward system, as well as opiates affecting our pain receptors. But what happens with the pleasure reward system is it strongly activates it. So if you're living at 100% of your pleasure reward system, if you have really good food, a great meal, if you have sex, it increases it by about 150 to 200%. If you use drugs, the initial time you use them, it increases it by 200 to 300%. So much greater than any natural thing you would use to get pleasure. Unfortunately, the first time you use the drugs, it goes up that high. When it comes down to its normal level, it's no longer at 100%, it's down. Every time you use drugs, you're looking for that 200 to 300%, but you'll never reach there again. It will never reach that pinnacle, but the clients are often looking for that. And every time they use, when the effect of the drug goes away, it decreases the level of the pleasure reward system. So soon the patients are simply using the drug to feel normal again, because when they're not using, their pleasure reward system is effectively not working. Over on the left side, you'll see the cerebral cortex, and that the frontal part of the cerebral cortex is where we get executive function, where we decide what's right and wrong, can decide risks versus benefits. This part of the brain doesn't fully form until our mid-20s. So if someone is exposed to drugs early on, say in their teens, their frontal cortex is not really very functional. So their ability to, choose the risk versus rewards of their behavior is limited. The addiction is really a battle between the frontal cortex and the midbrain. And with more and more use, the midbrain completely wins out, and the user can no longer use the frontal cortex to decide when to use and not. So that's why we consider this a brain disease. So in treating it, we treat it two different ways. We use medication to try to restore the pleasure reward system, and we use counseling to try to improve the function of the frontal lobe. Oh, I just lost.
Want me to go back one? Paul, do you want me to go back one?
Yeah, but I just actually lost my slide thing here.
Oh, no.
But I can keep going. I know the slides pretty well.
So the next slide is opioid versus
Yep.
opiate.
So opiates, this is just a definition thing. Opiates are your naturally occurring opiates. They are formed from the poppy seeds, poppy plants. And the natural ones include heroin and morphine and codeine. And through chemical manufacturing, we have formed other complexes. So an opioid would be any chemical, whether it be natural or manufactured, that would affect the opiate receptors in the brain. So this would include all the natural opiates, plus the manufactured substances such as hydrocodone, oxycodone, fentanyl, and methadone. And many of the drugs that people are using now are actually the synthetic opioids. Even when I see people who come into the emergency room and say that they have used heroin, almost invariably now their drug screens are negative for heroin and they're positive for fentanyl. So there's very little heroin out on the street now. I think the fentanyl is much more, less expensive to manufacture, but unfortunately it's much more dangerous because it's about 100 times as potent as the morphine. You can go to slide 8.
I don't have the number. Am I on the right one, Dr. Vinsel?
It's the national drug overdose deaths.
Oh, I'll go back one.
Okay.
There you go.
So this is a slide that carries us from late 1999 to close to the present. And we see that the overdose deaths in the United States were fairly at a level point. They start bumping up in the early 2000s. And what had happened was that in the late 1990s, a lot of different factors came into play so that physicians were treating pain more aggressively, using opiates much more freely than they were before. There was a lot of social aspects to this, as many of us have heard. Some of the pharmaceutical companies convinced physicians that this was the right thing to do. And physicians were told that if you use these drugs for patients who had real painful conditions, they would not be addictive. So, and also our regulatory bodies told us that we had to treat pain aggressively. So that occurred, and pretty quickly we can imagine what is going to happen. The patients did get addicted, and the level of overdose deaths increased. It was in the mid-2000s that we discovered this, and then physicians became much more limited in how much opiates they would prescribe. But unfortunately, a lot of our patients were already suffering from addiction. And if they couldn't get the opiates from their physicians, they would get it on the street. And this goes back to the changes in their brain that have occurred with chronic opiate use. So they're getting it on the street. They quickly realized that prescription drugs obtained illicitly were extremely expensive, prohibitively so. And they found that heroin was much less expensive. And this was supplied by different Mexican and Chinese cartels. So that led to a big spike in the early 2000 teens. And then when fentanyl came on board, that was about 2015, and you see a real sharp spike after that. This slide, though, doesn't cover 2018, 2019, 2020. So in 2018, national drug overdose deaths decreased down to 67,367. Unfortunately, in 2019, it spiked again to 70,980. And I don't have national numbers for the first half of 2020, but what people have been saying is that the overdose deaths have increased dramatically in 2020, and we certainly will see that in the Maine data that I'll give you on the next slide.
And Dr. Vinsel, I can tell you that my colleagues at the federal level are saying that they're nearing 2/3 increase.
That's pretty much what we're seeing in Maine. And if you go to the next slide, we go to the Maine overdose deaths. And you can see a very similar waveform in that graph, but you do see in Maine that when fentanyl hit in around 2015, the spike that we had is even greater than the spike nationally. And again, in Maine, just like the overall national, in 2018, our numbers decreased to 354 overdose deaths. But unfortunately, again, in 2019, we hit 380 overdose deaths, 33 of those in Androscoggin County. In the first 6 months of 2020, we've had 258 overdose deaths in the state of Maine. So that's on par to hit over 500 for the year. And in the first 6 months of 2020, 24 overdose deaths in Androscoggin County. So that is very worrisome. Exactly why that's occurring, most people are feeling that the COVID pandemic has really been specifically damaging to patients with addiction. They're alone. They have trouble seeking treatment. And I think that's adding to it.
Dr. Vinsel, I've moved ahead to the slide for drug-affected babies.
Okay, so you can see this. This is how many babies are born that suffer from opiate withdrawal. And you can see it has a very similar waveform to the waveform of overdose deaths. And that's because if you looked at the number of patients who are addicted to opiates, that would show the exact same graph. In 2018, in Maine, we had 904 babies that suffered from withdrawal after birth. And in 2019, that number came down a little bit to 858. And I don't have numbers for 2020 for that.
And now, Dr. Vinsel, we're at the ED induction project.
Okay, great. This is my favorite. So we have started a program in Bridgeton, ER, in Rumford ER, and in Central Maine Medical Center. And I know St. Mary's emergency department has a similar program, though I cannot give you any details of that. It's been a real work in progress. And when I first presented this to our ED medical staff in January of 2019, I was met with 0 staff that were approving of it. However, I just continued on, and with help from Catherine and putting on courses for X-waiver courses and just talking about it, and with my colleagues seeing the work I was doing with patients and how much it was changing my relationship to my patients, they've become much more on board. And right now, I would say probably about 10 to 20% of our ED staff has the X waiver to prescribe buprenorphine, and many more of that, more than 50%, are willing to start buprenorphine for patients in the emergency department. So it's a work in progress, but we are changing minds, and as we become more successful, it's changing more minds. It's also well supported by the ED medical directors of all 3 hospitals, so I'm very happy with that. I can tell you that in Bridgeton in 2019, we started over 30 patients with buprenorphine in the emergency department. When I looked at those numbers back in March, 95% of those had continued with at least 1 visit with an outpatient provider, and 85% were still in treatment a year after they were started. So that's really good numbers. I can't give you the numbers at Central Maine or in Rumford, and to tell you the truth, I have lost count of the numbers because I've been a little bit busy since the pandemic has started, and haven't been able to keep track of the numbers of patients we've started since that time.
I'm sorry, Dr. Vinsel, I don't mean to interrupt you, but I am looking at the clock and recognizing that we have a shortened period. So if you could give your closing comments.
Sure. So in the emergency room, we use opiate agonist therapy with buprenorphine or Suboxone, that's the active ingredient. It is a partial agonist, so it partially stimulates the opioid receptors and it partially blocks them. So the patients take it and it decreases their cravings, it decreases withdrawal, but it does not make them high. And overdose deaths, the risk of overdose death, if a person is using Suboxone, it decreases by 80% compared to those that are not. So that's why it's so important to get these people into treatment.
Thank you, Dr. Vinsel. Joe, I'm going to ask you to jump in, and mindful of the time, we need to have Celeste speak as well.
Okay, great.
Sorry, Catherine.
Hey, everybody.
That's okay.
So just a quick overview of Project Support You. That's a reincarnation of a program that we used to have over 10 years ago that the state used to fund before it eliminated funding, in which we had a crisis worker riding with police officers, going to calls, but while they were in the field with us, they could provide crisis management and provide those types of services. We lost that funding. I was really happy to see Project Support You come back. Right now, that project's looking to morph into what's called options. And that program is currently more focused on following up on those who have overdose or suffering from substance misuse disorder. But again, it's that co-response with law enforcement, and it's also working with the area of service providers to help these people get the right connections to find whatever path works for them to hopefully assist them in getting recovery. The future of the program, we're in the process of seeking grants to fund 2 additional positions, hopefully full-time. One will be focused on substance misuse disorder, and the second position will be focused on mental health. And then the Lewiston Sharps Collection Program was launched on July 6th of this year. You know, the reason why this program is important is it reduces the possibility of needle stick injuries. It could save thousands of dollars. To give you an example, according to Maine DHS, one syringe costs about 7.5 cents versus the cost of $143 to $1,000 per day for a treatment medicine to treat hepatitis C. This is really beneficial. In particular, it's actually our public works employees that come into contact quite a bit with these needles when they're cleaning out things like flower beds or doing some of the landscaping around the city. So having these boxes, the theory is, and it has been showing that we are getting usage, is to find a safe place for these needles to go to help avoid other people getting injured. You can go. So this map right here is an overview of where sharps have been found in 2020. This is a heat map that was generated. So in the corner right by the river where the city's connected with Auburn, you can see that bright yellow area, and that's generally the higher congestion area where we're finding our sharps. The next map. And this map shows a number of things. So one, you still have the heat map. So that each red dot is the point where sharps have been found. Each green dot is a location of a sharps collection box. And we also have included encampments in here, just to give an idea of generally where we're finding needles, where our boxes have been deployed, and trying to address the broader concerns that we've been receiving. It's also, I just want to point out that Public Works has created this map, and all of the data that you're seeing here highlighted is jointly entered into this map by both the police department and Public Works. This right here is the map that Jim Ward produced for us, that's accessible on the city's website. It shows the locations of all of our boxes and gives some instructions on where they go and what to do if you find a needle, or whatever have you. And that's again available on the city's website. And this right here is just 3 examples of what the sharps boxes look like and how they're deployed. So we have one right here at Sunnyside Park, another one on the Oak Street parking garage, and the last one pictured is on Walnut Street. This is an ongoing spreadsheet, and I just got updated numbers today, but you can see where each box has been deployed and how many sharps have been collected in those boxes. To explain the numbers to you, so for instance, when you're looking at 180 Pierce Street, on 8-6 you see 2, and then on 820 you see 2. That doesn't mean that there's 4, it means that there's 2 needles, so it's a rolling count. But to date, including today with the information that I just got this morning, we've collected over 71 sharps estimated across the city in these collection boxes. And, you know, going forward, we're going to continue to use our mapping software that we have to monitor trends to make sure our boxes are where they need to be. We also have some extras so we can deploy more than the 12 that we have placed across the city. We're going to continue to partner with service providers as needed to, again, keep this project going and increase public awareness. We have not publicly announced this. The boxes were deployed in part just so we can work out kinks as they go, but you know, as you can see that the usage is starting to pick up, but as a city, we have not put out much of an information campaign on it. And I just really want to especially recognize when this conversation started, it was really around the service providers and the police department, but Public Works has really stepped up. I mean, by and large, they're the ones that are operating this program day to day. And in particular, I just wanted to recognize Megan Bates, Reggie Poussard, and Jim Ward for their work on this. You know, they are filling a gap, especially where we don't have a public health department in the city. They're doing that for us. So huge kudos to them.
Les, you're up.
I'm up. Well, thank you, Catherine. I got involved with Tri-County a couple of years ago because I felt that it was really important to try to reduce the stigma that was around addiction and opioid use disorder, alcohol, and I wanted to be involved with that. all of the numbers that Dr. Vinsel gave you and the parts of the brain that he showed you, I've lived those. There's a lot of emotion in those brain centers. And I just wanted to say that I always feel that before I started misusing alcohol and having the disease of alcoholism, I had the disease of insecurity. I've talked to more people that have substance use disorder. We don't feel comfortable. We don't ever feel comfortable in our own skin. And we look for a way to get over that. And what Dr. Vinsel talks about, the 300%, I will tell you, when you pick up a drink or a drug and you're predisposed to that, it is the warm blanket out of the dryer. It is the grandma hug, and you love it. It takes away the fear. It takes away all the anxiety, and you chase it for years and years. And I chase that feeling, and it is very difficult to get that back. And you chase it until the disease takes everything you have. You're mental, physical, and spiritually bankrupt by the time that you are at the end of the chase. For me, I was very lucky. We talk about services. I was very lucky. I was employed. I was able to have insurance. I could get into a rehab program, but the disease was stronger. And even though I went to the rehab, addiction isn't, with all the wonderful services we have, addiction is not going in 30 days, coming out, you're done with it. Addiction is something, and substance use disorder is something that is with you forever. That does not mean that we have to relapse. I hear that over and over again. Well, people are going to relapse. If we give them Narcan, they're just going to use again. There's no reason that has to happen. And that's when I start feeling that I need to speak out, because this problem is everyone's problem. It's all over the community. It's all over the country. And the reason people relapse is because they do not have a good support system. It's not like somebody just cut my brake line that I'm relapsing. Things have been building up. And all of a sudden one day it's just too much and you use again. As of January 24th, 2002, I have not had to relapse. I have had consistent sobriety, and it's because of the support that I've had. I realized when I got sober, I had a home, I had a husband, I had family. They didn't like me very much, but I had them. I look at the people in the community that have no home. They have no idea where their next meal is coming from. They have no job. How do they stay sober? You know, my hat goes off to them. They have got such a tough road to hoe, and we should be getting services out there for them. If I had had somebody to talk to, I might have gotten sober sooner. I don't know. I've heard doctors ask us, you know, what do I say to get somebody to stay sober? And it's really a personal thing. You know, I had to come to that point where I was just sick and tired of the way I was living. But the point is, we need the services, because there can be a very small window of that time when you ask for help. And it has to be there. You need to have the rehab. You need to have the person to talk to. It takes money. But you look at all those numbers of people that have died from drug overdoses, and the ripple effect in the community is huge. The ripple effect on families, the experiences that children go through when they are in a family and they have had a parent die from a drug overdose, it affects them. And with my family, I had to break that cycle of addiction. It ran through my family, and it eventually landed with my daughter. And there was really nothing that I could do. She had to find her own way, and I found resources for her. But the lack of education, the lack of the truancy rates, all the things that contribute to this mental illness. Many people are using drugs and misusing drugs, unfortunately, because they're just trying to feel better. They have anxiety, they have depression, they have ADD, and it just makes them use when you find that drug. The stigma is really, really a problem. I found with Tri-County, one of the things we were going to do was public forums. And we did a public forum in Lewiston. It went very well. We did another public forum in Auburn. I thought that went very well until I saw the article that followed in the newspaper. And when I read that article, it hurt. It really hurt. And they talked about the doctors that spoke. They talked about the professionals. They talked about the law enforcement. And then they talked about the addicts came up and shared their story. They didn't even give us recovering addicts. We were just addicts, and it just hurt. It was not a good way to address us. We're not bad people trying to get good. We're sick people trying to get well. And at that point, I was so hurt, I swore I would never share my story again. I would never put myself through that. But here I am, sharing my story again, because I have to. I have to speak out for the people that aren't always able to speak out for themselves. And I feel that the community has to come together. We have to have not just the professional agencies, we need the Chamber of Commerce. People who lose time at work, the economic effects are terrible. People end up in jail. They're going to come out someday. What are their chances? Are we going to have productive people coming out? Are we going to have programs for them? Bruce Nodden is fantastic with what his programs are, but we really need to plan on how we are going to help the people. They're not intentional criminals. They were lied to, they were prescribed drugs, and they became addicted. And we have to help them. You can't jail somebody clean and sober. They need support. And the families that go through this, every one of those people that passed away, you know, their mother, a brother, a child, the parents shouldn't have to have their purpose in life to be explaining that drugs are bad. You know, we can blame big pharma, we can blame all sorts of things, but the reality is the situation is here. We really need to plan how we are going to deal with it. And I feel that our Rotary group has been working on opioid and suicide prevention programs, and just regular people, you know, not everybody that dies of a drug overdose was in the Tree Street area. You know, they're your bus driver, they're your teacher, they're people that just unfortunately overdosed, and it wasn't their fault. And I'll keep speaking out, and I really appreciate you listening to us, because you're the people that are able to help, and I'll keep speaking out to help as well. And I just want to thank you for taking the time to listen to me.
Thank you, Celeste. And I'm noticing that we have reached our cap in time. So this next slide is a new program that is rolling out in Lewiston. And I don't know, Mayor Care, do you want me to say more or just call it done?
Nope, go ahead and finish if you can just keep.
I can be very quick. So
Thank you.
Options is an end product of our work and project support you, which Joe just spoke to you about, the ride along program with the counselor and the law enforcement. The state, having noticed the work we were doing, sole sourced a contract to us for a 40-hour per week staff person that will be embedded at Lewiston PD, and will respond both proactively and reactively to individuals who are using substances, not just opioids, by the way, this is all substances, and will be able to provide screening, prevention, intervention, and referral to community-based resources. So this is a huge success for us, starting with 10 hours a week in project support you to now a 40-hour full-time position. And that will cover Androscoggin County, but clearly the focus is here in Lewiston, Auburn. And then last but not least, we've stood up in the midst of COVID a syringe exchange program so that folks that are actively using are using with clean needles, and we're hopefully reducing the spread of contagious diseases like HIV and hepatitis. We're also distributing Narcan, doing STD education and prevention. We have recovery coaches that are out there saying, let's get you into services and be able to support you. And we're promoting as much as possible medicine take back days and medicine disposal boxes. And that's it. Thank you for listening. There's so much more work to be done. This is the tip of the iceberg, but with all the work we've done together over the past 3 years, we firmly believe that we now have the foundation of a recovery-ready community.
All right, thank you, Catherine. So if we could drop the screen real quick. So I do, I realize we're a few minutes over time, but I would like to allow the council that may have a question. So any councilors have any questions or comments? Councilor Jelinas.
Thank you, Mr. Mayor. First of all, I just want to thank you, Catherine, for your leadership. This presentation was great. Dr. Vincel provided some excellent education. This is a topic I think that's wildly misunderstood. So I appreciate that. Thank you, Joe, for sharing information about Project Support You, and thank you, Celeste, for your courage to share your story. It's far-reaching for sure. I did have one quick question. When you talked about the Project Support You and you talked about the options position and the second position, I heard you sort of say that one of those positions was going to be for SUD, working with individuals who battle SUD, and another one was going to be for individuals with mental health issues. And I guess I'm just trying to understand, like, as I think about those, I don't often separate that. So I just wanted the logistics of how that's, like, I guess I don't really understand. I read Governor Mills' thing about options, and I heard you talk about that, Joe, the two different positions, but I'm not really understanding that, the logistics of that.
I can tell you that the options position was created specific to SUDS as the primary diagnosis. So we can do a one-time touch, but if we determine that that individual has primary presenting mental illness, then we will refer them back over to a pot of money that I will maintain 10 hours for consumers who have primary mental health.
I see. Okay.
So we will be able to serve both, but the options contract is specific to individuals with SUDS.
Thank you.
Mm-hmm.
All set, Councilor Jelinas. All right, Councilor Ray.
Thank you, Mr. Mayor, and thank you all for presenting to us. And you know, having heard this at the start of this presentation back last term, it's great to have an update on how the coordination is moving forward. The question that kind of popped to mind for me was trying to better understand the age range distribution of addiction in the Lewiston area and overdoses. I also sit on the school committee, and there is some infrastructure through the public school system for substance use coordinator at the high school. And I'm just wondering how that might factor into the work that we're talking about here.
So if you're asking if we coordinate with the school system, all of the above is absolutely true. So our staff are in and out of the schools. I mean, things are obviously very different right now in the midst of COVID. And I will tell you that it has indeed seen trends just literally spike up. So we're seeing increases in depression, anxiety, substance use, suicide, all of the above. And so really trying to deploy as many supports into the community as possible, working actively and coordinating services across all organizations in the schools and our Healthy Maine partnership. So Corey Brown was part of our steering committee. They've been very active with us as well.
All set, Councilor Ray. All right, thank you. So I have a quick question, Catherine. So we've met several times over a couple of year period, and you know, I got to tell you, I've kind of had this has been a process for me, because there are many in our community, including me. You know, we were brought up and educated that you never enable a person suffering from substance abuse disorder. They have to hit rock bottom, and that, you know, that's just the way it was for years. And I know many members in our community still have those beliefs. So if you had the opportunity to just try to get folks to, you know, be open-minded about the change in the treatment of this disorder, Is there anything you'd like to share with the community to wrap this up in that direction?
Absolutely. 3 things, and I will send them to you in writing and you can distribute them. So there are some wonderful pieces of literature that will help you to understand the history, the growth of this in our nation, what we've done at the top of the political ladder in terms of our administrations that have said, just say no to drugs, you know, and so all of those platforms which work to the detriment of people who are actually trying to move into recovery. So Dreamland by Sam Kionis, many of you will recognize his name. He's a well-known writer and speaker, which talks about the opioid process in America, starting way back to the dates that Dr. Vinsel just offered us. And then Johan Hari's book called Chasing the Scream, and it's about SUDs in general, substance use disorders in general, and how pushing people to just say no actually pushes them deeper into the dark well, and that there are platforms for recovery that have been established in other countries that have resulted in phenomenal success rates, 85, 90% success rates that we do not see here in this country. And there are things we could be doing differently. And then Rat Park, go to YouTube. It's Johan Hari again, but it's this little video that talks about how people become addicted and then what can help to undo that. And it's a really short, sweet video, Rat Park. So I will send you a little email and direct you to that. And we are willing to come individually, in groups. This project continues. This is fully sustainable. Everything we did continues, and there's more to come. So we are going to continue to grow the work, and not just here in this community. This is to serve Western Maine, and we are actually working closely with Gordon Smith and the governor's task force to make sure that all of our learnings get shared across the state with the other folks that are doing this in their counties.
All right. Thank you very much for your passion, Catherine. Thank you, Dr. Benzo. Thank you, Joe. And thank you, Celeste, for taking the time to be with the City Council this evening. Thank you.
Thank you for having us.
Thank you.
Have a great evening.
Thanks. Hey, Dale, if you could bring in the folks, I believe Sean Yardley, Nate Libby, Dennis Lord, and Steve McDermott. Okay, real quick for the public's information. So we're in a workshop right now. So this is an opportunity for Sean and his team to present a proposal for a temporary homeless shelter. And then we'll have another workshop session with our housing committee. Once we're done our workshops, then we actually have an agenda item to approve a matter in reference to the temporary homeless shelter. It'll be at that point that the public will be invited to share their thoughts and make comments. But during the workshop, we're just going to have the information presented to us and allow councilors time to ask questions. With that said, Sean, if you're ready, you can introduce your team and then take it away.
Sure. Good evening. I'm Sean Yardley. I'm the CEO of Community Concepts. And with me tonight is Nate Libby, who has been working as a consultant from the time we opened the temporary shelter last spring, the wellness shelter, and has continued on with some additional work that we've been doing around providing COVID positive housing for people that need to be isolated because they've tested positive. And now we're coming before the council to talk about a 28 bed low barrier winter wellness shelter. I have with us tonight Steve McDermott and Denise Lord from Maine Housing, who we've been in conversations with, who have been looking to support these types of temporary shelters across the state in order to reduce the spread of COVID, keep people safe, especially as we enter the winter season. So that's really what we're bringing before you tonight. We're proposing to operate a temporary 28-bed, low-barrier winter wellness shelter, staffed 24 hours a day, that will serve unsheltered individuals at a local hotel. And we learned a lot from our experience last summer. We fully expect to see a great demand, but our plan is not just to offer shelter, but to immediately connect people with resources that can address the reasons why they're homeless. And for some, that's a matter of connecting them to more appropriate housing. For others, sort of following up on your previous discussion, it may be people that suffer actively from substance use disorder, mental illness, that may need additional supports in order for them to have safe alternatives that won't rely on, a low barrier wellness shelter. I believe you received a copy of a memo. Is that correct, Mayor? Did everyone receive that? So I won't go into that. I'll be glad to answer questions. I want to give the other folks that have joined me tonight a chance to speak if they wish, or just be available to answer questions. Denise, is there anything that you wanted to say before we enter into the workshop piece? Or Stephen?
There's nothing from my end other than being available to answer any questions that you may have, and hope to provide any clarity around lingering issues.
And I see Denise is unmuted. So Denise, do you have anything you'd like to add? So I'm not sure if there's some technical difficulties or.
Nate, is there anything you want to add as someone that's seeing it every day and had the experience that you've had over the last several months in both the wellness shelter as well as the COVID positive shelter?
Sure. So to that point, I'd say that when we operated the wellness shelter, we worked really hard, given the short time that we had, to connect as many of our guests with case management services, services related to substance use disorder, and other treatment that they required, and to connect them to permanent housing. Given the short time frame that we were operating under, I think we were fairly successful at getting folks placed and connected with resources. But at the end of the day, about 60% of our folks who are with us went back out to the streets with just sort of case management services in hand. I think based on what we learned during the wellness shelter project, that we would take the opportunity during this winter wellness shelter project to really push hard in getting people the help and support and the permanent housing they need. And I think the end effect of that is at the end of the project in the spring, having fewer folks in our community who are sleeping outside. And I think that's probably the primary benefit of a project like this.
Okay, so before I turn it over to the council, can we talk about the experience around the temporary wellness shelter at the Armory, some of the challenges that you saw, how you addressed them, what you think the end result was when it came to some of the challenges with that homeless population?
Yeah, I think I'll start. I think operating a wellness shelter April through July is going to be a much different experience than operating a shelter through the coldest months in Maine. But we did face challenges. This was, people could come and go. We tested them when they came back in, did temperature screens. We tried to make sure they were safe. But when you're talking 16 hours of daylight, there were challenges. People didn't want to stay inside the shelter. understandably, they wanted to be out in the fresh air. And so that did create interactions with the neighbors. We tried to manage that. We did outreach to the community, to the neighborhood. I think there are always going to be some folks that aren't supportive of this in their community or not in their neighborhood for sure. And so we did face those challenges. The staff worked hard to be good neighbors. We tried to make sure that the guests that we had were respectful in the neighborhood. And we're committed to do that again. It is a challenge. It is a population. If they are actively suffering from mental illness or substance use disorder, there are limits on how much we can do to manage that, but we're committed to do that. We want to be good neighbors wherever we're located. And the reality is, they're in our community, spread out across the community. If you don't have a shelter, and the shelter concentrates them in one area, and that concentrates the complaints, it concentrates their profile in the community. But I don't think anyone would suggest that these problems didn't exist across Lewiston with these individuals if they were going to be acting out, if they were going to be actively mentally ill, untreated. And so I just want to put that out there. I think we offer an alternative that's more humane and gives us an opportunity to engage. And I absolutely have no doubt that we limited the spread of COVID during the time that shelter was open. We had one positive asymptomatic person. We immediately isolated them. We also quarantined any of the people that had close contact per CDC guidance. And one of the challenges with prevention is you really don't know what you've prevented. But to think that we had 137 guests over that 4-month period, one positive and no spread, I think protected the entire community, not just the people that were guests in the shelter. And I think that's really important. I think the difference will be, we're entering the cold months, we're entering the shorter days. There is going to be less enticement for people to go out and stay outside and be more visible, maybe create more anxiety in the neighborhood, but also we're going to keep them safer, and by extension, all of us safer. And I think that's really, really important. We are dealing with COVID, as you know, at a much higher rate. I've been reading emails while I was waiting to come on. There's going to be announcements that there's significant community spread that's leading to entire school departments being shut down. We ourselves are experiencing that. We were fortunate. Community Concepts has 300 employees, and up until 2 weeks ago, we had 0 positive cases. And we've just the last week had to close 3 Head Start sites because of positive tests. And so if we thought it was bad when we opened in the end of March, with people being inside and closed and all of the things that go with winter in Maine, it's a real serious issue. So that's one of the reasons that Community Concepts has agreed to step up again. I've told the mayor, Community Concepts does not have a plan, does not want to be part of the plan to create a permanent shelter in Lewiston. It just seemed like with the needs in the community right now, being asked to do this, having, I believe, a success last spring, despite some of the neighbors' complaints. I think overall, if people were to look at this as objectively as they could, we achieved our objective. I think it's really, really important. And that's why Community Concepts, that's why our board has supported us bringing forward to you tonight and agreeing to be the provider on behalf of Maine Housing with the funding that they're going to provide to offer this service in Lewiston. But it needs all of us to be supportive of it for it to be successful, I believe.
All right, thank you, and I appreciate you answering that. And I just want to share before I turn it over to the council. I was impressed with everything I heard about the wellness shelter's staff and how they address community concerns. And at the very end, when that sheet was hung out there, thanking the community, just I thought really good touches in a community that wasn't expecting a shelter to be placed at the Armory. So thank you.
Mayor, if I could just very briefly.
Yep.
The banner that you're talking about was actually the idea of guests. Guests put that together. I also want to give credit where credit's due. That some of the guests were very concerned about the neighborhood complaints and worked with staff to organize canvases and trash pickups throughout the neighborhood. And then finally, our senior staff at the shelter did canvass and introduce themselves to residents, handed out business cards with a direct line to the shelter, talked through the process for making reports to staff, and that definitely helped our ability to address neighborhood complaints as they came up. But I just wanted to make sure it was known that guests and staff were involved in a lot of that work.
Good, thank you for clarifying that. So I see one hand up. Just this is the opportunity for councilors to ask any tough or easy questions, but now's the opportunity. Councilor Ray.
Thank you, Mr. Mayor. I was just going to start trying to respond to you, but I think Sean and Nate did that quite nicely. As the counselor in the ward where the first wellness shelter was, it was good to know who to contact in response to constituent concerns. And I was always incredibly impressed with the responsiveness of the folks who I was in contact with, and with the resultant behavior of folks. I think there were many strides made to take some community responsibility, and it was a vast improvement, and you know, staff and guests alike. So that's in response to your question, Mayor Kerr. I have 3 questions. So the first is, there's no funding coming from the city. Is that correct? That was a quick no.
There's no funding for
Okay.
the city.
Great. Easy question first. The second, why is it that this winter shelter is going through this sort of process when the spring one didn't? Is it just because of emergent needs? I'm just trying to wrap my head a little bit around why you need a thumbs up from us now.
Nate, do you want to hop on that, or would you like me to take that?
I was gonna maybe suggest Dennis looked like he was about to answer.
Yeah, I think that maybe pointed at me, Councilor Ray, a little bit. So I think ultimately back in March, April, when this was going on, I think the scenario or the situation was just different. I think for the community, and I think where we are now in November, although the numbers and the cases are certainly rising, and the dynamic is changing around all this, and I think Sean and Nate really covered that well, and the need is there. Just felt that this required a public discussion and an opportunity for folks to be able to understand what was occurring here, and that's really why this is being brought forward to you now. I think under the state of emergency that we're currently under, again, the authority was there to sign off on this and make this happen, I think, without bringing it to the city council in April. But again, the scenario, I think, in the situation is different now, and I think it's just important that there was a public discussion around this, and that's why it's here tonight.
And I'll just add, back at the start of the temporary wellness shelter at the Armory, truly with the pandemic, there was so many unknowns, and we were all just wasn't sure, if this was going to be just a rush of cases. But I will add, we're seeing more cases now than we did back then, which is also concerning. So I don't think we can forget that. But that's a good question. Thank you, Councilor Ray.
And
I have
even
one-
though even though the city isn't putting funding up, I think we're in it together. And I, as a leader of Community Concepts, I did not want to go someplace in our programming that the city wasn't supportive of. I think whether you're putting money in or not, I think we're in it together. And I didn't want to be out in front of what the leadership of the city was comfortable with, frankly.
And one more question and then just a general statement, if that's okay. Has the housing stock changed at all since the close of the shelter? I think one thing that I heard in speaking with staff myself was that folks were making strides. They were under case management. It was just availability of housing was really tight around those months, and understandably so. Has anything changed drastically? Do we anticipate changes by the end date that's assigned here?
Nate?
So it's a great question, Councilor Ray. I think the simple answer is the fundamentals of the housing market have not changed substantially since we operated the wellness shelter. I think what is significant and different this time around, though, is having the winter period from mid-November through the end of April will give us an extended period of time to work on a case-by-case basis to get people placed. And it is not easy to get someone placed in a week, but it is very much doable to get someone placed in a month or in 6 weeks by turning over every stone, looking throughout Lewiston, Auburn, but the surrounding 5 or 6 counties. There are limitations to placement. It's got to be a good fit on a number of different levels, but I think we were so under the gun, so to speak, during the Armory project. We were grateful for a 17-day extension that came in July, but I think with this project having a longer runway is going to help us get a higher success rate in placement.
I think that sounds great and is the whole game here. The thing that I guess I am disappointed about is winter type weather has already come to Lewiston. There have been nights where I have to turn my heat on, and there are folks who have had to sleep outdoors or in encampments over this period of time. And I realized there were circumstances that kind of pushed this meeting out a little bit further, but I just have to say, I would have gone to a meeting on any night to talk about this a bit earlier and help you all with your process moving forward faster, because I just have to think that a housing first model is going to be what's best for the folks who come through this shelter and who need that opportunity for wellness.
Okay, thank you. Councilor Clement?
Thank you, Mr. Mayor. Approximately 4 questions and possibly comment thereafter. I'll toss these out and whoever wants to take them can. It's my understanding that there's no limit on the catchment area for the shelter. Anybody from any place can come and partake of the services. Is that correct?
Yes, to be totally honest, that geography is not going to be a precondition. We expect that we're going to serve primarily people from the greater Lewiston area. It's always a question. I've been involved with homeless issues for the last 20 years, and there have been lots of studies done, and I can say with almost certainty there will be more people from Lewiston in shelters and on the streets of Portland than there will be people from away coming to Lewiston for homeless services. That's been my experience when I was in Bangor. It's been my experience for my 9 years on the State Homeless Council. And we've done national, there's been national point in times, and we've had more people from the state of Maine in shelters across the country than we have people from out of state coming in. So you're right, there is not any screen that says if you don't live here, you can't be sheltered. The condition is that they're in need of shelter.
Okay, expanding on that a little bit, somewhere in the material that was presented to us, there's an indication that I believe the word guests has been used. We'll continue with that line, that guests will be referred to resources. one of those resources listed was general assistance. My understanding of Maine law would be that if you apply for general assistance, there is no geographical requirement. If I come from Portland today and walk into the office here in Lewiston and say, I need general assistance, they kind of have to provide it to me. I don't know whether anyone can answer that under current law or not, but that is a concern. I'm basing all of this on concerns that have been raised by my constituents. I've had as much contact on this particular issue as anything that we've addressed as a council since January when we first met. So these are concerns that extend across the ward.
So I was the GA administrator in Bangor for 9 years, and that's always the question. The law is a little vague on that. It's the last residence, legal residence is responsible for general assistance. My experience has been, no matter what community I've worked in, that the state's oversight of that has not been as strict as you or I might like it to be. But in this case, we are not going, we have no plans to bill general assistance for the homeless shelter that we're providing. So in fact, it's possible that the burden on local GA would be even less because people have the opportunity to come to the shelter. GA has the opportunity to refer. When I was in Bangor and there was a permanent shelter, we had negotiated with that shelter a reduced rate for particularly single adults to go to the shelter, and it was at a reduced. It was less of a cost than trying to find them an apartment if we could find one. So in effect, if in terms of specifically constituent concern, since the city is not putting any money into this shelter and there's no plan to bill the city of Lewiston for any residents of Lewiston that go to the shelter, there actually could be a reduction in general assistance costs.
Yeah, I base my question on the fact that years ago in the capital city of Maine, the courts told the city of Augusta, we had a major psychiatric hospital there. We had a veterans hospital there. People would come out of those facilities and they'd stop at City Hall. I need this, and they were being refused. And a court case, Maine Supreme Judicial Court ruled on that, saying you got to provide it for them. That's the only reason I brought that up. I don't know that that's changed. I would think that'd be precedent. Another question. What sort of rules, regulations will be in effect for the shelter? And would you be willing to provide the city a copy of those rules, regulations prior to any approval?
Nate, you've been working on that. Do you want to field that question in terms of what the guidelines that we're proposing to employ around substance use and behaviors and things like that?
Right. So we have a set of rules and guidelines that we ask every guest or client to agree to and sign their name to before they're offered a spot at the wellness shelter. Some of those rules and expectations include maintaining social distancing and abiding by CDC guidelines for COVID prevention, prohibition on substance possession or use, alcohol possession or use while on the premises, prohibition against weapons, violent behavior, bullying activity, verbal abuse, harassment, all of those kinds of things. Our rules also speak to a 9 p.m. curfew that at the wellness shelter experience, we kept to the second. We have to be tough on those guidelines and those expectations because it sets the tone for how the entire operation is going to work. If someone comes to us and they are struggling with substance use disorder or alcohol use, we work with them to get connected to resources to help them. We will give them reasonable opportunities to take advantage of those resources. But if that behavior crosses into, into behavior that's disruptive to staff or guests, or crosses any legal thresholds, those are immediate terms of expulsion. So we try to create a space that is governed by rules that are tough but fair, and our staff try to implement them with compassion. In terms of sharing the rules and expectations, I don't know that we can provide that for the upcoming vote here, but we could certainly discuss sharing those if that's appropriate.
Perhaps we could consider tabling it until such time as we have them, but I keep hearing that there are no city funds involved in this, but I would believe these are taxpayer funds. Just more taxpayers, a larger area is supporting this. Instead of the city of Lewiston, it would be state of Maine, federal, whatever. These are taxpayer dollars, are they not? I think
Yeah,
that's a very important differentiation right there.
Okay, so let's let somebody answer the question. So I think Denise is trying to chime in.
Sure. This is Denise Lord from Maine Housing. I apologize. I've been having technical difficulties, but to answer your question, Councilor Clement, the resources that are used.
I'm sorry, Mr. Mayor, she's breaking up and I can't understand a word that's being said.
Thank you, Councilor Clement.
Is this better now?
It is, and you really got a lot of feedback. Could Stephen cover that for you?
Sure.
So right now, the funds that will be used, Maine Housing will seek the public assistance program from FEMA to reimburse for the cost associated with the program.
So taxpayer dollars, correct?
I don't know what the originating source is for the FEMA public assistance program, but that's the program that Maine Housing will be seeking reimbursement from.
I think one can assume this is going to be taxpayer dollars through state or federal.
Thank you, Mr. Mayor.
But it won't be directly out of property taxpayers of Lewiston. It'll be in a different direction.
Spread over a wider area, I understand. But
Councilor Clement, do you have any further questions?
Yes, let me go down through here and make sure that we've covered everything. This particular location is not prime for certain services. However, public safety services, I think, are probably very likely to become involved with the location. What sort of contingency plan is there? At the Armory shelter, it became necessary to have a police officer there 24 hours a day. We're moving people into a facility, a commercial facility that has a full liquor license. They have a restaurant there. They have the general public in certain areas, I'm sure. I see the potential for conflict there. How are we going to address that? Are we going to have police officers there? Are you going to expect the city to provide that service as needed? Or is this going to be something that will be taken care of under the terms of the agreement?
So I can try to respond to some of this, and I do want to go back to your other question. We had about 20% of the guests that were at the Armory that actually were employed. So they were taxpayers as well as being consumers. And I think we all are on this call, all taxpayers and consumers of federal, state, and local services. In terms of the police, the necessity of the police, we actually built into our budget, because of the circumstances and the location at the Armory. I think we contracted with Lewiston PD just short of $200,000 that we paid for them just to be on site. So it wasn't, we never found it particularly necessary for them to be present. We made that decision in part because, in a summertime situation, people are outside a whole lot more than we anticipate them being in this situation. But if they came to Community Concepts and we had a disturbance at Community Concepts, we would be calling the police to perform the duties that local law enforcement would provide. And so if the need arose in this situation, we would do the same thing in order to maintain peace and safety for not only our staff, but for the other guests, yes, we would be doing that.
You would be doing, I'm not sure I caught what you'd be doing. You'd be calling on the service, or you'd be
We'd be,
establishing a contract to provide that service, or what?
no, we'd be calling the police to say we have a disturbance, just like I would at Community Concepts when we have a
Okay.
trespasser or something like that. We pay property tax as an agency, and one of the services we get back from the city would be the support and protection of law enforcement.
I understand that. I also understand that if an area in the city, for instance, a liquor license creates significant problems, then sooner or later, they're going to lose their license. The police are not going to be stationed there all the time as part of the taxpayers supporting that. I think basically that covers everything I've had. I will reserve further comment, Mr. Mayor, until we go to vote on this. I'll bring up
Okay,
constituent
thank you.
concerns at that time.
Thank
Thank
you. Councilor Jelinas.
Thank you, Mr. Mayor. Most of my questions have been answered, although I will make a couple points. I agree with, the city administrator regarding just the importance of this coming before us all and having an opportunity for public discussion. I think transparency and as you said, Sean, we're in this together. I couldn't have said that any better. I think this is really important stuff. And clearly, there were a lot of lessons learned during the operation of the Wellness Center at the Armory. I'm a strong believer in, hindsight is 2020. We look back and we learn a lot from that. So I'm curious about one of the statistics, one of the numbers that you shared, Nate, was the fact that, and I think I understood this right, 60%, when this was done in July, 60% of the 138 people still remained after that within that homeless status. Is that correct?
Yeah, that's the rough general number. When folks were with us for, more than a week, we had a much higher likelihood of getting them connected to services. We served 138 total over the course of the period at a 60-bed shelter.
Right.
Of the folks that were with us at the end, a large number did have to go back out to the streets, unfortunately.
Okay, thank you for that. I just, that like Councilor Ray said, just one of my biggest concerns for sure. But the other thing I wanted just to ask about is, certainly the wellness shelter had 60 guests per night, and this particular proposal is looking at 28 beds. Can you talk a little bit that when I look at the staffing pattern that you presented in terms of, how many staff would be there, how does that compare to what we were doing at the Armory? Is that equivalent? I mean, because I know it's a different ratio. It's a different equation, but is it about the same, or have we changed that at all?
At the Armory, we had 60 guests and we had 4 shelter workers per shift.
Okay.
So the staff to guest ratio improves a little bit in
Yes.
this new setting with a smaller number.
Okay. And then my last question real quick was wondering if you can share a little bit about, you talked about, that we can't necessarily say where these people are coming from, whether it's from, Lewiston, Auburn area or outside, but can you talk a little bit about the criteria for entry?
Yep. The basic criteria is a person must be able to do the activities of daily living on their own independently. And because we are on a second floor of a hotel that does not require an elevator, person must be ambulatory. Those are really the 2 criteria that we use to decide whether a person's a good fit for the shelter. We do try to create a low barrier situation where folks are coming to us with persistent or chronic, mental health conditions or substance use disorders or co-occurring situations. Folks that are really having a difficult time, we want to be able to serve them, try to help them, and get them into a better spot in life.
Okay. Thank you.
All right, thank you. Councilor Jensen.
Thank you, Mr. Mayor. A couple of questions, and Councilor Clements' questions brought up a couple of my own. So I didn't really get a clear answer on the question he asked. So if people come to Lewiston from outside of the city, like for homeless services, if they come for that, can they apply for general assistance in the city? yes or no?
They can apply. They may be receive service, and then it actually gets negotiated between the municipality that the person last lived in and the jurisdiction where the person is applying now. And that's behind the scenes, and it's usually mediated by the Department of Health and Human Services, who ultimately is responsible for the general assistance provided.
Okay, but it's fair to say that the taxpayers of Lewiston would pay at least part of that.
Well,
Well, they-
I would say not necessarily, and based on the experience at the wellness shelter, the vast majority of folks we served were coming from Lewiston, Auburn, and the surrounding communities in Androscoggin. The remaining folks largely came from Oxford, Franklin, Kennebec, Saginaw, Lincoln, Cumberland, so the 6 or 7 surrounding counties. And if they were coming to us from those areas, they often wanted to get back home to those areas into more stable housing arrangements. They wanted to get back to places where they had family and friend networks, where they had some services. They were in many of those out of town cases, so to speak. We were helping them get back to where they wanted to go, which was often, their home area.
Okay. Okay. So speaking with the Armory shelter there, did any residents that came from outside of Lewiston apply for general assistance in Lewiston?
I don't know that the CCI team would have the information to answer that. I don't know.
Okay. I know you mentioned, Sean, that maybe people might actually like voluntarily give up some general assistance in order to receive services at the homeless shelter to maybe reduce GA costs. I guess that was a little confusing to me. Could you talk about that a little more?
No, what I was saying was that if general assistance had someone come in, it's typical for general assistance to ask folks to take advantage of available resources. GA doesn't guarantee that someone gets housing. In my experience, people have to either find the housing themselves or be connected to it. And what I'm saying is if they were referred to the shelter, or if they were at the shelter first and then went to GA, they wouldn't necessarily get benefits that would be then spent somewhere else. So if a housing was being provided for in the wellness shelter, then that would not be a cost that necessarily the city GA program would be responsible for. We're not going to turn around and bill the city for a night bed, for a day stay.
So this is Denise Lord from Maine Housing. Our experience working with other communities who are using hotels as wellness shelters or overflow shelters is they're doing it in large part to relieve the burden on general assistance. That general assistance is an emergency safety net, and if someone has nowhere to go, many communities are placing families and individuals in hotels and paying for it through general assistance. So the communities we've been working with, Portland and now Lewiston, has been in part to relieve the burden on general assistance by giving you another option.
Okay, that's a fantastic, I like that point. It's a great argument to make. I just don't think it's been brought up yet here in the discussions that we've had in Lewiston, which hearing about it now makes a lot of sense, but it's kind of unfortunate that we haven't really talked about that aspect. I guess, what were some examples of incidents that happened at the Armory that we might be on the lookout for, that residents would have to kind of like expect, like any criminal incidents, like what specifically was going on that we could point to?
I think the most common complaint we received was around litter. And so that was a very frequent neighborhood complaint that staff and guests would attend to. Other times there were folks, congregating, in areas that, that caused some neighbors to have concerns. But I think that was driven by the very warm June and July that we experienced, and the fact that the Armory does not have a modern climate control system. So during the daytime, it easily got up to over 85 degrees inside, and being outdoors was respite that folks could have. So those are the really common ones. There were, examples of substance use going on, which is to be expected, given that, we know going eyes wide in that we're helping folks deal with those issues. Those were the primary types of behaviors that we saw that we tried really hard to mitigate to the best of our ability.
Was there anything that would directly threaten the safety of anyone, like litter, like anything like dangerous left around, or any like break-ins or anything like that?
I'm not aware of any break-ins. We did enforce, the no weapons policy, and acted on that a couple of times to remove weapons from the premises that were brought in when that was brought to our attention. There were the occasional verbal altercations between guests that staff, given their training in de-escalation and crisis management, were able to manage and de-escalate, I think, in a successful way. I'm not aware that there were any behaviors that went beyond that, or that there were criminal charges of any significant matter filed against anyone at the wellness shelter.
Okay, excellent. Yeah, some tough questioning. I do view that the Armory shelter as a grand success, so I do want to point that out, make that clear too. It's important that we have expectations as clear as we can going forward here. The last question I have is, it's really just an estimate, but about from how far away do you think people will likely travel to get services at the new shelter?
It's hard to tell, but I expect we'll see the vast majority of our clients coming from Lewiston and Auburn and the surrounding communities. I think we'll probably see a handful from the surrounding counties. There may be occasion where we're talking with counterparts in Bangor or Portland about, us referring a client to them or them referring a client to us. I mean, there is a back and forth that way, but I would expect the vast majority are from Lewiston, Auburn, and say 30-mile radius, 20-mile radius, something like that.
Okay, awesome. I'll end my questions there. I appreciate the answers, and I'll just take this opportunity to remind Lewiston's surrounding neighbors that we do often do a lot of things to help our surrounding neighbors out, and they'd be very appreciative of those surrounding communities to understand that. So thank you.
Okay, thank you. Councilor Khalid.
Thank you, Mayor. First, I want to thank Community Concepts for the work that they are doing and for leading this much needed program. Only one question, a lot of my questions have been answered. So I saw it in the reading that there were going to be 28 beds or guests. Will that increase? And I'm thinking, well, will you be able to find additional beds?
We have no plan to go beyond the 28 beds. And if we were to change the scope, we would have long discussions internally and would come back to the council, but we do not anticipate doing that.
Can I do a follow-up question? So if you can afford, if there's a limit of 28 beds and more people are coming to you and they need help, will you be turning those individuals around?
So I would be advocating with the state, with the city, with other nonprofits. Again, I firmly believe it's in the best interest of everybody that we don't have people living on the streets. I think there's a humane issue, there's a public safety issue. They're gonna, if you're on the street, you're gonna try to find someplace warm. I think that break-ins, my experience, break-ins happen, abandoned buildings get broken into. There's lots of unintended consequences of people being homeless. I would certainly want to have a conversation about that. I will tell you, when you see people that you're turning away and you go home at night, it's hard not to think about where they've gone and what the implications for our communities are from that. So, but I would not exceed the 28 beds unless there were conversations at all levels of government and across the community. What are we going to do? And it has to be a community solution. And we would not take it upon ourselves to go beyond what we represented tonight. You have my word on that.
Okay, thank you. Anything else, Councilor Khalid? Okay. So we have several more hands. I just, one of the concerns I have as mayor, one, I support this temporary shelter. I believe the COVID numbers justify it. I believe there's a lack of a sustainable plan at the state level, so that creates an urgent issue, I believe. What I hope, though, is that Maine Housing and our state delegation look at homelessness as a statewide issue so that 3 major service centers don't increase their population of homeless because they're the ones who are actually trying to do something to provide services. And what I see throughout the state is the 3 service centers, once they announce that they want to do something good and provide services to our homeless, like the state and every community should be doing, is you actually increase your homeless populations. And when you do that, you increase the challenges that they bring to your community. So this is a temporary solution to me that I support, again, because of our COVID numbers. But somehow we have to get this discussion to be happening as passionately at the state government level as it is in municipalities. So just a little commentary, and I apologize, but I imagine I'm going to say that a few more times. I believe Councilor Ray was the first of the second. Your hand's up.
It was Councilor Clement was up before me. I don't want to hop ahead.
All right. Typically, I'll say I called you to take it, but this evening I'll go with Councilor Clement.
Thank you, Mr. Mayor. Just backing up to a second about the problems at the Armory, problems that I heard relating to the good neighbor thing, were people finding guests trespassing on their private property, urinating on their private property, defecating on their private property. Certainly this cannot be viewed as being good neighbor. These issues really reverberated with a lot of people out there and cast a very wide net across people in the city. Because I've heard about it, well, I know somebody that lives in that area, this is a problem they had. So was that something that you folks were aware of from the Armory experience at all?
Councilor Clement, I tried to give an overview of some of the issues that we heard from the neighborhood and talked in general terms about ways we resolve them. There were specific instances that were exceptionally challenging, but I'm not going to rehash each one of those here this evening. And I'll also share with you that the stories that I heard about behaviors that were going on at the wellness shelter in the community did not always match up with the actual experience that our staff observed. So I do know that there were issues in the community, in the neighborhood. We worked very diligently to address them to the satisfaction of the neighborhood. Some of the behaviors were certainly not acceptable, and we treated them as such. But some of the stories were exaggerated as well.
Thank you.
Okay, Councilor Ray.
Thank you very much. So I'm glad I had that unfold the way it did, because I was going to respond to Councilor Jensen and his direct questions about the area environment during the Armory version of this. And what I was going to say is there was a misattribution to behaviors of people who were not affiliated with the shelter at all. Events happening at 11 p.m. Those aren't guests at the shelter if there's a 9 p.m. curfew that is very strictly enforced. So I just wanted to highlight that for folks. And then the second part that I wanted to ask of probably Sean and Nate, last time around, a direct phone number was given out to folks after some conversation. I know I had it. And I had a contact person as the counselor responding to many of the constituent concerns. Is there going to be a direct person number, something of that sort, that can be given to, especially the counselor of that ward, but maybe all of the counselors and the mayor to address concerns as they might come up?
Yes, we can do that.
Okay, thank you. All set, Councilor Ray? All right, Councilor Jelinas?
Thank you, Mr. Mayor. So, absolutely addressing this issue, it must and it needs to be addressed, absolutely. And I'm on board with that 100%. Just curious why this particular location is being considered. And I say that not just because it's my ward, but because I am very curious about resources that surround this location as opposed to other hotels that are located in different areas. I'm also concerned about traffic in that area. It's pretty fast. It's just concerning for me when I think about that. A whole lot of traffic going on. It's not a real pedestrian area for sure. And just wondering if we could get some comments on that.
So the area that we're using, it's the hotel that was willing to work with us,
Okay.
and that's sort of just the fact of the matter. And in terms of kind of pedestrian flow and traffic, there is a bus stop nearby. There are some paths to take to main artery sidewalks that I think are relatively safe. Certainly talking through those things as part of our orientation with each new guest or client that we're serving.
Thank you.
And just a quick follow-up to that. You said there's a bus stop nearby. How far away? I don't need to know the location. I just need how far from there.
If it's not adjacent to the property, it's a very short walk.
All right. So if it isn't adjacent to the property, and this is approved one way or the other, we should really make an attempt to put it in a request with the transit to have a location at a stop at that location. And I don't think that'd be too challenging, but I think it's just a small process. Councilor LaJoy.
Thank you, Mr. Mayor. I guess it's a question and a comment in a sense. With the previous experience that you had this past year with the shelter that you set up, you've learned a lot of lessons. Based on that, are those some of the areas that you're looking at to better this particular shelter based on those experiences you've learned?
Yes, thank you, Councilor LaJoy, for the question. A couple of lessons I think that stick out most to us. Number one is the value of case management services, making meaningful connections between clients or guests and their case managers. And our work in that front didn't begin in earnest at the beginning of the project because we were on such a truncated timeline. We were still building the airplane in midair, so to speak. So it took a few weeks to bring the right decision makers from the case management agencies to the table and to create that coordinating structure to make sure that each guest was getting connected in the most efficient, meaningful way possible. So that's a lesson, a complex human service kind of challenge that we learned a lot from, and we'll be able to build upon that structure in the very early days of this next project. So that I think was probably the most significant lesson that we learned. I think the other thing that we learned is that, and this may be a trivial point to some, but the quality of food service is really important. I mean, if you think of Maslow's hierarchy of needs, food and shelter, a warm place to stay are right at the base. And if you don't have those pieces in place, it's hard to deal with the other issues of, substance use disorder and all of those kinds of things. So to that end, we're very pleased that the Green Ladle has offered to step up in partnership with many local Lewiston Auburn restaurants to provide incredibly high quality food service at a very good price that provides a significant community benefit by keeping LRTC students busy on a big, meaningful project. And so we're pretty pleased with that. And we think the guests will like that as well.
And I do want to point out if it's okay, we stood up the shelter back in the end of March, early April, 13 days after we were approached by the city if Community Concepts would do that. We had to bring on all 25 staff in those 13 days, train them, get everything, all the logistics worked out. So we truly were building the plane as we were flying it. We now have some experienced staff who have stayed with us. We have the benefit of the experience and the lessons learned. And I think we're going into it with a lot of those pieces sort of answered that are going to allow us to build on what we've learned. And I feel much more comfortable. I was nervous last spring. It was a request that was made. We made heroic efforts to do it. You know, honestly, we were very fortunate to attract the people that we attracted to work for us. And so we're starting in a much better place than we did when we were starting from scratch. And so I'm much more confident going into this experience than I was last March.
Good. I just have one more question. With regards as to transportation, you mentioned that you may have individuals or an individual that may come from outside our community and they want to get back to work and they want to get back into their community, and you try to set that ability up. Is transportation thought of in that particular instance with regards as to providing that? Or would that be, I mean, would the person have to walk there or something like that? I'm just looking at, the mayor mentioned getting in touch with the bus line, possibly getting in touch with the taxi cabs and stuff like that as well might be something that I would bring up. You may have thought of that already. That may already be on your mind, but it's just a question.
It's a great question. I think for those that are employed but are experiencing homelessness, we want to make sure they can continue their employment. That's a key piece for their success in getting back out of the shelter into their next home. So we'll work with folks to make sure they've got transportation to and from their work. For other folks who need to get to case management or medical appointments, we'll make sure that either through the retrofitted vans that CCI has outfitted with plexiglass partition for socially distant COVID safe transport, that we can provide transport to medical appointments and case management appointments and things like that. But at the same time, there will be some challenges we may not be able to overcome if a person is coming from Franklin County and needs to commute to their job there. I don't know that we'd be able to meet that need, as an example. I think we can try to make connections and make local transportation work for many folks, but there are limits to that.
Okay, thank you.
Thank you. That's it for me right now.
Thank you. Councilor
Thank you.
Clement, do you have a final question?
Yes, thank you, Mr. Mayor. I just want to quickly say that I concur with both yourself and Councilor Jelinas on the need for this type of service. I'm not sure that I see Lewiston as being the place for everybody to gravitate to. The thing that bothers me most about this whole thing is the lack of publicity attendant to tonight's meeting. I've yet to see anything. Maybe it's been there, maybe I've missed it in the local paper, or the comments that have come to me have all been word of mouth. And I think the public should have a chance to have an active discussion on this and weigh in on it. I'm not sure that that's going to happen tonight, and that's it for me. Thank you.
Thank you. All right. First of all, I'd just like to thank Denise Lord for taking time to be here this evening, Steve McDermott as well. We appreciate you folks being part of this and sharing your thoughts with the City Council. Sean and Nate, as always, you two great community members, and much appreciated that you took the opportunity to be here with us. And I think you'll stick around probably to the vote, I suspect. All right, so we have another workshop that we expect will last about 45 minutes, and then we'll take on the 2 agenda items. So thank you.
Thank you for having us.
Thank you. All right, Dale.
Mr. Mayor, I'm
Yeah.
just going to step away for 1 second. It sounds like my front door is open.
Okay. So it sounds like Craig Saddlemeyer is presenting on the next one, Dale.
I'm presenting.
Yeah, well, I'm sorry, that was, I misspoke. Although we are going to offer you the opportunity just to quickly, do you have video by chance?
Yeah, hold on one sec.
We like video in public meetings. I hope you combed your hair.
Yeah, I took care of that by just getting rid of the hair altogether. Hold on one second. Something going on with my video.
All right, thank you, Craig. So this was at the request of the chair of the Housing Committee. He asked that the council take this item up again for general discussion. So Craig, is there anything you'd like to highlight before I turn it over to the council?
No, I mean, I guess at the moment I would say, you know, I'm pleased with what was presented by Sean and Nate regarding our recommendation for hotel rooms as temporary shelter for unhoused people. I think there were a lot of good questions that council asked and a lot of good answers that were offered. As Councillor Ray emphasized, you know, it's cold. Well, today was actually a beautiful day, but it is getting cold. Shelter is needed. And the sooner this can be enacted, the more we can help people in their personal lives and also help avert the spread of COVID-19, which we know statewide is becoming, you know, increasing rapidly and not going in the direction that we want it to. So I'm encouraged by what they've brought forward, and I hope the council supports it. Those are my immediate comments, but I'm happy to
All right, thank you.
respond to other thoughts.
All right. So I have to share, as mayor, it's very challenging to get a recommendation from a committee with no financial impact attached to it. And I don't know if in the future, administration could consider that when we get recommendations like this, that we have that attached, because it's really easy to look at several of these and say, oh yeah, that's a great idea. It's much different, and I'm sure you understand this, Craig, because you went through a few budget processes yourself. It's really much different to say that and then be faced with the budget and trying to identify where our investments will go. So that's just my quick thought for this evening on that subject. I'm sure I'll have another one or two. So I think at this point, you know, I'm not sure how the council wants to handle this. We can go through each item individually, or if the council has specific questions about any item, we can do that. Do we have any thoughts from the council? Okay, seeing Councilor Clement. You're on mute.
the sticky mute button again, I guess. I think what happens, I lay a pad and it must hit the space bar, which cancels it out again. Looking at the recommendations, I have only one comment, and that's on item H as in Henry, mitigating evictions. I'm as compassionate as the next person, but I feel this compassion also for landlords. I think we have to look at the larger picture. You know, I recognize the fact that Lewiston is probably, it says here, has the largest number of evictions in Maine. I don't doubt that. Having been involved in that in a previous life, we would counsel landlords to be very careful as to who they accepted for tenants, et cetera, et cetera. Don't let them get $3,000-4,000 into arrears, but it still happened. But not to make the landlord, and I say landlord, and I'm talking about the good landlord, not the one who's running a poor facility at an increased cost and not treating his tenants the way he should. But that concerns me, that we'd be looking to mitigate evictions without somehow taking into consideration the fact that there are landlords out there that depend on this for their livelihood. Thank you.
Okay, thank you, Councilor Ray.
Thank you, Mr. Mayor. So a couple of things on this list that we've been looking at. The first one, I suppose, would be for staff asking about letter E, public bathrooms. The recommendation is that the city should provide CDBG or CARES Act funding for a mobile facility. Where does our CARES Act funding currently lay? Is that something we could extend before? I think it's sometime soon that we have to expend fund. No, that's CRF money. Do we have funding for that in there, or could it be applicable through CDBG?
So that's a great question. So staff can answer that, but I'd also ask them to kind of update us on a public health committee recommendation. I think Dale's been working on some bathroom potentials, but if you guys could handle both of those, Dennis.
A couple of things. One, in terms of, I believe you're referring to the state grant, the grants that we've had recently, that, you know, through the CARES Act and that. We do not have any more funding on that. That grant has been expended, to start with that. CDBG funding, I think, depending on obviously the location, would need to be in one of the census tracts, which the biggest need is no question in there. So the CDBG funding could be, I believe, applied to that. I would just need to get more confirmation from our community development department, but I believe that the initial discussions I had with them that that would be eligible under that. And in terms of the work, the Public Health Committee was actually researching options. I think they've had some initial discussions on that. Deputy City Administrator Dowdy and I also had some discussions with our Public Works Department, and I know that they're doing some actual research on some of these just in terms of cost, and looking at some other different models of public bathrooms, and trying to gather some of that basic preliminary information for us. That actually began, I think it was October 14th, the day after the workshop, when Mr. Settlemeyer actually presented all this initially. Just some of that behind the scenes work was being reviewed to answer the mayor's question.
So when do you think we could expect some type of formal presentation on that specific subject? And so the reason why I speak kind of with urgency is because of some of the complaints that we received about inappropriate activity when it comes to restrooms and lack of. So go ahead.
Yeah, so I think it's hard for me to maybe set a specific date, you know, right now, but I can say that certainly if this is the desire, the council, for us to move forward in that direction, then what we would do is obviously put, you know, additional emphasis and resources into gathering that information to come back. But I don't think it would be terribly long, but setting a specific date right now on the spot might be difficult without me being able to circle back with staff and understanding exactly what's involved to bring that forward, especially with the CDBG funding as well. I'd want them to have time to work through all that and make sure that we have everything lined up appropriately.
Okay.
Can I just ask a follow-up having to do with that?
Yeah.
So are you my brain is not computing this the way I want it to. CDBG funding, what is the cycle for that? I know there's a CDBG committee, but I think that might be different from what funding we're talking about right now. Does it have to be part of the budget cycle for FY22? What's the deal?
So that's actually would be part of the work that I need to work with staff to understand exactly what that process. That's why it's difficult for me to say right now, this would be, we can come back on a date certain. I really need to be able to work with staff. I know there was some very preliminary discussions, I think, at the housing committee. I don't know if Mr. Settlemyer can maybe speak to that. I think CDBG money was discussed, but I don't know what level of detail they got into on that. And I just want to be able to work with staff, come back with what the process would be for them to be able to address that through CDBG funding.
Okay. I just think this is a huge priority given behaviors that have happened in the community, and you know, the fact that that can be slightly less staff intensive as a resource for unhoused populations. And it will increase, you know, just the public health side of things as well, if that's a facility that we have and we maintain as part of our regular duties. I think for me, that feels like the lowest barrier with the highest reward for us to prioritize. But if I'm wrong, Craig, definitely tell me that.
No, if I can't speak to the exact specifics of the funding. The information I received from Heidi was that there is some, you know, some more. We do have the traditional, you know, annual sort of CDBG budgeting process, but that the CARES Act money and I think some additional CDBG money that was received specifically for emergency response to COVID-related issues. I think there is some more discretionary power that we have outside of that typical budgeting process, but that needs to be double checked. I would take that as fact at the moment.
Thank you. Councilor Khalid, is your question or comment in reference to the letter E, the public bathrooms? So no, just so we have some. And is it in reference to one of the letters here, one of the items they're recommending? Okay, so I think just to have some order, instead of bouncing around, I'll probably start at A and work our way through real quick. If that's okay. All right, thank you. So A is, it speaks about the city's role in this, I'm assuming more of the regional aspect of homelessness. Dennis, do you have anything to share briefly with the council what our role has been thus far? You've had many conversations over the past 6 months, I think.
Yeah, I mean, I guess the most recent conversations that I've been involved in are regarding some conversations with the state. It was talked a little bit about in the previous workshop item, and the need, as you said, Mayor yourself, the need for the state to play a large role and this to be addressed from a more regional statewide standpoint. And I know I've been invited to a couple of discussions where they've tried to understand, I think from the state and more regional level, of just exactly what we're experiencing in our service center communities. I joined a call with the state with the Lewiston representatives, Lewiston, Portland, and Bangor, 3 largest cities. And we were able to talk through the challenges that we certainly are working through, and we're able to share some of the recommendations that actually I was able to share some of those that we've in some of these recent discussions. So I think they've been positive in that regard. I think the conversations have been good in that. That there seems to be a general understanding of that the state does need to take a prominent role in working with our service center communities. And I think Lewiston's role will continue, and certainly from my seat is to continue to be at the table for those discussions so we can ensure that momentum on that discussion continues.
All right, good, thank you. Any questions or comments specific to that with Dennis or Craig? And Craig, you're welcome to chime in too at any point. All right.
I don't have any additional comments at the moment.
Okay, thank you. So letter B, I think, we just had a pretty good explanation about the possibility of a temporary shelter at a hotel. Is there any questions or comments from the council in reference to that? Okay, increased case management. As I think it was brought up a little bit during tonight, currently the police department is attempting to secure grant money, and we know there will at least be a budget item potentially with the police department. We're also working on some type of possibility of locating grant money or finding funding for services within our library when it comes to case management. But I think that's something that's in progress. Where Dennis, is there anything, Dennis or Dale, is there anything you'd like to add? What steps the city's working? I mean, we've clearly, I think at a point we recognize this is, we need to start thinking about this, correct?
I guess I'm not understanding. Can you kind of restate the question, Mayor? It's for terms of conversations around, all of this subject. Certainly the conversations are there and occurring, but I guess specifically around enhancing day shelter facilities is your question? Is that?
No, it's more around case management, providing social services along with our other responsibilities. I mean, lots of discussions happening around that.
Yes, let me clarify then. Thank you. Yes, so we've had a number of discussions, not only with our police department. We've been having a discussion also with our library. Library director is certainly researching opportunities to expand case management services, hopefully out of the library at some point. Obviously, currently with the COVID numbers and everything we're experiencing in the community right now, public access to the library is limited. But we obviously are still keeping our eye on the longer range goals and moving forward. So I don't have a ton of details on that because I think she's in the very preliminary stages of that research and trying to pull that together. But to the mayor's point, the conversations are happening. I think the work is starting to happen. I think it's just going to take some time, but I think there's good work on the staff side. I know again, like the mayor alluded to, we will expect from the police department some budget requests coming forward for additional support around the case management for the police officers and obviously the community. I think those conversations will continue to evolve and I think just get better as we go forward.
And I also think we're always trying to identify areas where our partners in the community, the many nonprofits, can also kind of play a role here. Obviously, Tri-County has stepped up to the plate, but there are other nonprofits that we can turn to. Councilor Ray?
Thank you, Mr. Mayor. Off of what you were just saying, so I know of resources for mental health, substance use, survivors of domestic violence. What do we have in the area for veterans? I can't think of anything off the top of my head in that kind of specialized area. I know Preble Streets is referenced here, but do they operate services in Lewiston or is that just Portland?
So we have the Veterans Inc. and they are a transitional housing program for veterans. And then I believe they provide services like case management and stuff. I think, Dennis, you might have to tell me, is it 20 beds that they have in the transitional program or something in that area, I think.
And if I may add, Mark, Preble Street Homeless Veterans Program is here and helping veterans in the community. Preble Street doesn't operate a shelter or anything like that here, but Preble Street does have employees that serve veterans in our community and surrounding communities as well.
Good. And to answer your question, the mayor, it is 20 beds that facility currently has.
Okay, and it's our understanding, because we did recently, I think through city administration, there was some work done to identify the services, but it's a referral-based service, so they just need to be referred by the VA, and I think there was some other potential. So I've heard nothing. Go ahead, I'm sorry.
Yeah, so I think helping us as resources in the community delineate between these different services is helpful. So like we got the whole, it wasn't a memo, but it was like what the beds were that were open at shelters, and someone had put Sophia's house on there, and I wouldn't consider that a shelter. It is more supportive housing. And so I think having a better understanding of that holistically as counselors start and try to be resources for folks in the community, I think that is something that could really be done easily. Having those kind of tracking where beds are available and what services are offered at each location might be more helpful.
Okay, good point. So we'll try to, as this comes up again in the future, we'll just try to make sure we update it and try to get as much on it as possible. So that's kind of the work that's been happening on, and I'm going to call it case management, but it's really a much broader subject of social services in different areas. One thing I did that did intrigue me on the housing committee's recommendation was the ESHAP navigators. I would assume that's a lower cost than typical social services. Does anyone Craig, do you have any information on the cost of those services or anything?
I'm not sure what the cost, what an ESHAP navigator gets paid versus another mental health caseworker. I think as we describe in item C, it's the importance of the distinction is the resources they have access to, and the navigators, the ESHAP navigators, just have more tools available to them in terms of vouchers and other resources. And I think in their training to get people into stable housing.
Okay.
In addition to bringing sort of that mental health lens as well. Whereas many other folks that are not ESHAP can help connect people for mental health services and have some housing related tools available to them, but not the full scope that ESHAP does. And that was something that a number of the people that we talked to that are experts in this subject really emphasized how important that is. And again, the fact that our community has far fewer ESHAP navigators than other communities typically would, because we don't have an overnight shelter with those navigators participating in the state system.
Okay, thank you. So I think there is a lot of work happening around that social service aspect. Is there any questions or comments from the council in reference to increased case management, paragraph C? Okay. Enhanced day shelter facilities. As mayor, I'll say we need 16 of these in the state of Maine, in every county, provided to service centers so that we can truly make a significant impact on the 2,100 plus per day homeless rate in the state of Maine. Councilor Khalid.
Thank you, Mayor. This was the letter that I wanted to speak about. So my question is, Dennis or any staff, what kind of position is the city in leading, assessing, looking at facilities that are right now not being used or private facilities to help identify space that could, meet this need?
The city certainly could take a role in participating if that's the direction of the council, that we want to explore that. We can certainly do that. I would certainly emphasize we do not have experts on city staff. We don't have a public health department that's generally focused on this. So we would definitely need to rely on some community partners, I think, that are experts in this area, to help us understand the needs and what we would be looking for. But in terms of leading a process, I think if that's the direction of the council, the city can certainly do that.
Thank you.
And we do, so we have a day shelter at Trinity, but the location is probably the biggest issue there. Is that, you're shaking your head no, Craig? Did you want to comment on that?
Well, yeah, just that the Trinity is far more limited because of the new capacity limits under COVID-19. Trinity's doing what they can, but the service that they offer now as a result of that is not comparable to what they had before. But up until the pandemic, Trinity was our warming shelter during the day.
And was it
and the library was as well. Losing the library is another public warming space that we don't have anymore.
Right. And was Trinity ever big enough to handle the population that they were dealing with, even non-COVID times?
I've talked to Aaron before, and I would want to reconfirm with them, but I don't recall Aaron telling me that during the cold months they had to turn people away because of capacity issues. I mean, I think that Trinity could benefit a lot from improvements or expansions to their space, but I hadn't heard of that being a problem in the past.
Okay, all right, thank you. Councilor Ray.
Thank you, Mr. Mayor. I wanted to comment. I don't know how much of I think we should be moving forward with some form of day shelter facility that involves the city. I think the library takes in a lot of those folks and is used as such, where those professionals in that building are trained to do maybe something a little bit different. And I think they're wonderfully compassionate and expansive in their skill set. I think having either dedicated folks who work out of the library or looking at other spaces we have. I know the Violations Bureau, that lease went up. I think there's some LPD and other folks who are in there now. I think about other places where there are already city staff across the city. I just think this has to be a higher priority for us because I just can't imagine. I'm a total wimp about being too cold and having people and the number of homeless youth who have to sleep outside in the winter. It just seems like a compounding effect to me. And so starting with day shelter, if folks aren't, as we get down to G, don't want to talk about an overnight shelter, I think this is something that might be more manageable.
Yeah, so thank you for that. And I think you bring up valid points. I'm just really concerned that it's just a bunch of Band-Aids and we're not addressing the issues. Our state needs resource centers so that we can get people placed. And if we, and the city being involved in a daytime shelter would be at a significant expense. And I'm open to it and I want to hear more. But I struggle with communities just immediately turning to Band-Aids when it's not really addressing the issue. And state resource centers throughout the state would stop the mobility of homelessness so that, communities are providing services where they're needed by those persons. And I know I've said this 3 times and I won't repeat everything, but go ahead, Councilor Ray.
I just want to ask, so this is the second time Craig has come before us with the same set of recommendations. And I think the first time was a good opportunity for us to take it in, and now is a good time for us to respond. But if we're not going to entertain these conversations, then, and I don't mean to be flip, I'm sorry if this sounds that way, but like, are we asking the housing committee to come back with different recommendations? It just sounds like a lot of like, we need more information still at this point. And I'm just wondering, should we just make a prioritization list through consensus, through discussion with this group that, housing committee go back and really focus on E, whatever it is, and work through one problem rather than, I feel like maybe we just have a difference of approach, Mr. Mayor, but it just seems like we can come up with an excuse one way or the other on every one of these items. I just think we have to, I personally would pick something, commit to it, have the housing committee work on that, have public health committee weigh in and keep moving on.
So no, I think that's exactly kind of what we're working to, but we are going through everything on the list. But I personally think that if we're talking kind of within our community only and not looking at the bigger picture, I just think part of the conversation has to involve a broader approach versus just Lewiston, because we're not serving just Lewiston residents. We're serving a broad base of people from several areas throughout the state. So no, I think you're right. I think anything that we're talking about tonight, a counselor can, try to ask for a thumbs up or ask me to ask for a thumbs up. So if that's something we want to focus on, we could do that. Absolutely.
I guess, sorry, I'm going to keep poking this one because I just want to understand. So who else needs to be in this conversation? We have a housing committee. It is very particular in who its membership can be. And that was by design when the housing committee was established. And I believe it's very tightly related to Lewiston. And so as we talk about unhoused individuals and communities and populations in Lewiston, it's going to be very laser focused on the needs here, right? And the solutions here, I think too. So I'm not sure if everyone's seen that kind of commission for the committee, but it's very, very specific about who can participate in it. And I'm sure you all have guests and folks who come in and lend their expertise, but it just seems at odds that we have a Lewiston Housing Committee working to address Lewiston community issues, but we also need to, we do need to be in concert with state resources and or county resources, whatever it may be. Maybe I'm being dense, but I need to understand who those people need to be at the table for what solution.
Yeah, no, I don't think you're being dense at all, because I think you're right. We do have to, I think you're right. We do have to have this community discussion. I'm just going to constantly remind the council that if we focus on just Lewiston without holding folks at the state level accountable for a statewide issue, then what we'll end up doing is we'll pay our property taxpayers will pay for providing services to non-Lewiston residents at a scale that could become, I think, concerning for our community. So, but you're absolutely right. Like the daytime shelter, that's a local discussion. But I just hope people realize or always remember that this is a statewide issue that that 3 major service centers are being forced to deal with it in a more direct way than any other community in the state. And I'll shut up at that point. Anything else, Councilor Ray?
Not at this moment.
Thank you. Councilor Clement?
Thank you, Mr. Mayor. Let me jump in and say that I agree with your assessment of things. I could easily support city staff assessing resources, but I look upon Lewiston as being a service center. I mean, we have 2 hospitals here. People gravitate to Lewiston. So we're going to get people during the daytime that come in. Once we establish perhaps some resources that could be utilized in this fashion, maybe we need to go to our county commissioners or to surrounding communities and say, hey, what do you want to do to help us out with this? We'd be doing you a favor if we can establish something. We'd be taking the burden off you during the daytime. But I don't see us going alone. I don't think we should be supporting the folks coming from wherever. I realize Auburn will probably be here quite a little bit, but there'll be other communities coming in. They gravitate towards the services we have, particularly the 2 hospitals. And we'd be catching people from a much larger area. And I don't think that we want to burden Lewiston taxpayers with it because, as you say, it could be a significant expense. You're going to have to create staff. You're going to have, in times of the pandemic, it's going to be just that much more because of the sanitation, hygiene, all of those different things that are going to enter into the picture. But I would support assessing what we have available to see if there's some way that we can address this issue. I don't want to sound as though I'm not compassionate at all. I mean, when the temperature gets down there in the wintertime, in the daytime, I think it's important that that people who are wearing, cardboard for shoes and stuff ought to be able to get inside where it's warm. And to that end, I can support looking into it and seeing what we can come up with. Thank you.
Thank you. So day shelter services. Would the council like to look into this more? Thumbs up. Let me get some thumbs up or thumbs down here, folks. All right, majority thumbs up with a couple of sideways thumbs. So Dennis, if you could just give that some thought and maybe we'll go from there. Okay. Craig, anything you want to add on that subject before we move on?
No, not at this time.
All right, thank you. Support, so we have just a couple more. Supportive housing. So it encourages the city to encourage development of more supportive housing. I think that you're probably speaking of kind of like Tedford housing type programs.
That's a good example. Yep.
Okay. So when's the last time, how long ago, is that the last type of housing, supportive housing that happened in Lewiston, was the Tedford program, or is there others?
Well, as Councilor Ray mentioned, Sophia's house, I think, is a recent example of a certain, rather unique form of supportive housing. But supportive housing recognizes that there's some people that are more, facing challenges that make it harder for them to keep and maintain regular housing, and it's still well worth the investment to as a community to have them in a home versus unhoused, and that they can succeed with a certain type of support. So yeah, transitional housing is one type of example, but there might be other forms of housing that offers certain mental health services or casework services. So it can take a number of different forms, but we think that, we have folks that would be well served by this, and it would produce better community benefits than those people just having the option of dangerous housing where their where their challenges sort of go unsupported, and they're left more to kind of unregulated circumstances to live out those challenges. So this is not, it takes a long time to develop new housing. This is one of the more general recommendations that we have here, but we do think it's important. Lewiston has done some. We think it's important to continue recognizing this need as we consider our community needs lots of different types of housing. We also need, more market rate housing, and supportive housing and everything in between. But we want to make sure that we keep our eye on the fact that this is important to continue supporting.
Yeah, I think you put it very well, that it's something that just needs to be in our thought process as we work through different style of housings in the future. Councilor Ray?
Thank you. Yeah, and my point was going to be, I've seen the support come in a few different ways. So I know Tedford comes up on CDBG each cycle. The other thing I think of is Sophia's house with the TIF district that was set up for their program. I didn't vote on it, so I didn't get as much information from that process since I had a conflict of interest. But I think as those things come forward to us, having the economic development department explain to us how it relates to supportive housing and relating it back to that priority would be helpful.
Any other questions or comments around that subject? Okay.
Sorry, I'll just jump in to add. So Maine Housing gets money from the National Housing Trust Fund each year, and has a whole sort of qualified allocation process, but they are always prioritizing supportive housing with those funds, and they have well documented the needs. So just want to point out that there are sort of some specific funds set aside at the state level for supportive housing.
All right, thank you. And I think we had a little bit of discussions already about mitigating eviction. So the other recommendation is a permanent overnight low barrier shelter. Questions, comments, thoughts of the council on this item? I have one, but I've said it like 10 times tonight, so I'll just refer to my previous comments on jumping to that level without looking at other areas. Councilor Jelinas.
Thank you. Yeah, Craig, I guess I wonder, is this recommendation, does this fall into the category also of, this is a more general recommendation, or are there specific discussions going on currently around maybe some proposals, or, you know, you reference in here in the recommendation, you know, potential partners, you know, is that just kind of like hoping for potential partners or something currently going on?
I don't think there's nothing in development to my knowledge at the moment. What we wanted to convey with this recommendation is that, you know, it was identified a long time ago by a community plan to end homelessness that we need a overnight low barrier shelter in our community. And that our approach as a community to that, you know, no one has in any substantial way really denied that need. We don't see any evidence that the need has gone away. And as a city, and I you know, I include myself in this as having been a city councilor and served on other committees during that time period, we have not done much in any kind of leadership role to help facilitate this happening. I think it has been more of a, well, the plan's out there, maybe someone will come along and propose, you know, doing this in a way that we would support. And so that hasn't yielded anything. While our unhoused population is, you know, still very much present and in need of shelter. The pandemic has changed some things. And, you know, that is one of the reasons why we think the hotel rooms could be a great, at least temporary solution. And we may learn that there's more to explore with hotel rooms as, I mean, still as ultimately temporary for those individuals, but it may play a role in a more long-term solution related to serving this need. So I think our main point is we can't, you know, we need to play an active leadership role in this issue. The need is still here. There's some conditions changing around, you know, research on congregate shelters versus the need for more privacy for public health reasons. And also just case management outcomes that seem to be better with hotel rooms. So we don't think that we should, I think our committee, with the amount of time we've had to turn around these recommendations, I don't think we're ready to say we should be committed to this method just for the sake of being committed to that method. But we are interested in the results are important. You know, we want to see the outcomes. And this has been the primary idea we've been considering so far. And we need to keep moving forward on it until we come up with something better. But I think as a committee, we're paying close attention, and we're hoping that, you know, the city staff and elected officials are also invested in paying attention to this issue with us and trying to identify what is the best solution. And I'll just take a moment to also, you know, share that my feelings, you know, I think resonate with some of the other feelings that the mayor and Councilor Lee expressed as well around the city of Lewiston's role, which we did try to articulate that, you know, we do see this as a regional issue. We believe that the state and surrounding communities have a responsibility to share the responsibility of solving these challenges together. You know, for the most part, we saw our role as a committee to highlight what we think the challenges and the needs are and some of the most available solutions to us. And I think my main hope is that we don't see the need for a shared regional approach to this as an excuse not to be a leader on it. So I agree with that sentiment, but I want to make sure that we don't use that as a reason to stop making progress on them. But we are absolutely in agreement and in support of naming that shared responsibility and holding our neighboring communities to account for it as well.
Very good. Thank you so much.
Mr. Mayor, you're on mute.
Well, that doesn't happen too often to me. I agree that we can't let it limit what we do as a community, but being a leader also can be advocating at that state level to make a dramatic difference at the, across the state. So I think that comes in a couple of different forms. Councilor Ray.
Thank you, Mr. Mayor. I think during just previous workshop that we just had, an area nonprofit that we might look to for partnership in this space said they weren't interested in establishing a permanent shelter. And so I'd be very curious to dig into that, the reasons why. Are those barriers on the city side, or those barriers elsewhere? And by identifying those, hoping to eliminate them through our work and our leadership, I'd be very curious to hear more about that.
Okay, thank you. Councilor Clement. You're on mute.
Once again, we go with the button. I'll just echo what has been said real briefly, that it is a regional problem. It demands a regional solution. Last fall, I knocked on somewhere around 3,500 doors in my ward. The one thing that I heard over and over and over again is we as taxpayers of the city of Lewiston do not want to fund a low barrier or no barrier homeless shelter. I don't have a problem with the city getting involved and facilitating something, but I do not see us getting involved with taxpayer dollars for such a thing. And I'm sure that the people in my ward will back me if they think that's going to happen. If not, they can vote me out. So that's all I have to say. Thank you.
Thank you. Craig, once again, we really appreciate you taking the time to be with the council this evening and answering the questions we had and sharing your thoughts. So thank you.
Thank you very much.
All right. So let's take a 5-minute break, and then we'll resume to our last couple of agenda items. Is that okay with council? Okay. And if we could turn off our video, yeah. Okay, we're just waiting for Zach and we'll get going. We do have to get the recorder back on, so that'll just take a moment. Okay, I think we're all back. So Dale, and we're live again. So hold on one sec. Okay, so we'll move into our special council meeting. And with that, if the clerk could call the roll for attendance, please.
Sure. Counselor from Ward 1.
Present.
Ward 2.
Here.
Ward 3.
Present.
Ward 4.
Present.
Ward 5.
Present.
Ward 6.
Present.
And Ward 7.
Present.
We'll also note for the record, Mr. Mayor, that the City Administrator Dennis Dote is present, as well as the Deputy City Administrator Dale Dowdy and myself as the City Clerk. Thank you.
Thank you very much. And just for general info, councilors, we still have Mr. Yardley, Mr. Libby, and his guests available in the attendees should councilors have any further questions. With that, agenda item number 1, please.
Sure. Item number 1, authorizing the city administrator to execute the Maine Housing Certification of Approval to use Maine Housing Emergency Solutions grant funding to authorize Community Concepts to operate a temporary homeless shelter in the city of Lewiston. Requested action to authorize the city administrator to execute the Maine Housing Certification of Approval to Emergency Solutions grant funding to operate a temporary homeless shelter in the city of Lewiston.
So moved.
Second.
Okay, moved by Councilor Ray, seconded by Councilor Khalid. Questions or comments from the council? Councilor, and I'll just remind, we'll be going to public comment period as well. So if we keep this period for more clarifying questions, Councilor Clement.
Yes, Mr. Mayor, just a quick question. I've been told that there were a number of questions from the public that have been emailed in. Do we have those? Do we know what they are?
Okay.
Thank you.
Mayor, city councilors, I do have an email that was sent to the public comment email that from a John Connor. I can read through those email, I guess, questions. How would you like me to handle that? I'm certainly, our typical practice is to forward those to the city council email. Just give me how you'd like me to proceed. I can read the questions or just continue with that practice and forward them along to you.
No, I think are they questions or comments, and how many do you have, Dennis?
There is 8 questions that they all have question marks. So without reading them, just seeing them now, they appear to be 8 questions.
Okay. No, I think considering we're on Zoom, it would probably be good to run through those questions. Go ahead, Councilor Jelinas.
Might it be that Lewiston resident is here tonight and may want to
Yeah, that's true, because some of these folks are here and they may
Yes.
just come on naturally. That's a good point.
And I see him listed, so I don't know if his hand's up or not, but I'm sorry.
Right. Okay, Councilor Ray.
The only thing that so we did this with school committee and had the superintendent read for folks who weren't here. We started with public comment live for people in person and on our webinar, just to filter through that. And then the only thing we had to be kind of cognizant of was limiting the superintendent to reading only 3 minutes of that, since that is the rule for folks who are here in person live as well. So just from experience, wanted to share those couple of things if they're helpful.
Yeah, no, thank you very much. So I'll keep it at the council right now. Any other questions from councilors? Okay, seeing none, we'll turn to public comments. So members of the public may make public comments. It'll be limited to, it needs to be related to the specific agenda item, and it'll be limited to 3 minutes per comment. In general, we don't allow back and forth questioning between public commenters and city staff. So I think it's kind of in conflict with questions that come to us via email. So, but within reason, staff may be able to have a response. If it's something more detailed, we will have to get back to the public. So I would encourage more of a public comment versus a extended question period from anyone in the public. With that said, can we bring in Joshua Nige? Hello, Joshua.
Hello.
Hey, thank you for attending our meeting tonight. Do you have a public comment?
I do. First, I just want to say good evening to you, Mr. Mayor, all of the counselors, Dale and Dennis. And just really quickly, as far as the temporary shelter is concerned, as far as the expenses that everybody's considering right now, one, it's actually not coming from the taxpayer at the moment. And I think it's more of a moral question than either a political or a financial question. Ultimately, it's not the best solution, obviously, but it is a solution, and we don't have one in place right now. So if it saves one person from freezing to death, if it saves general assistance funds from spending 20 trips to the emergency rooms, these types of things need to be considered when you consider temporary shelter. I just want to throw that out there. And then also tying into the conversation with the presentation from the Housing Committee, when we're speaking about community development block grant funds, I actually live in a community that qualifies for community development block grant funds. And when we're talking about something like a public bathroom that's mobile, I would possibly suggest looking at putting public bathrooms in some of our public parks. They're more useful, in my opinion, to a wider range of people. And also, unhomed people actually live in my community. They're my neighbors in a way. And those facilities would be more accessible. So I just wanted to point that out. And that's basically all I have to say. I appreciate the opportunity to speak.
All right, thank you, sir. So I'm going to backpedal a little bit on questions. So typically at a council meeting, we wouldn't allow questions back and forth. So I think any questions that were emailed to Dennis, then that person should receive their answer either through city administration or the mayor's office. So Dennis, if you could just check through your list, if there's a public comment in any of those emails without a question, then we'll read them after we're done the true public comment period. All right, so if we could bring in Chris Bicknell.
And Mr. Mayor, while he's being elevated, if I could just remind Dale or Dennis that one of you will have to do the timing for the speakers for the 3 minutes because Heather isn't here this evening. So good, thank you.
All right, thank you. Good evening, Mr. Bicknell.
Thank you for letting me speak. For those who don't know me, I'm Executive Director of New Beginnings in Lewiston. I am a member of the Statewide Homeless Council. I'm on the board of the Maine Continuum of Care. I am the chair of the Statewide Homeless Youth Provider Group, and I have been building, designing, and operating shelters in Maine since 2004. I'd like to say first and foremost that I was in the beginning phases of helping to stand up the wellness shelter in Lewiston and was extremely impressed with CCI's performance after having done this for almost 20 years. Nate Libby as well was extremely professional. The shelter was run as well or better than most shelters in the state. And that was extremely hard to do in the 13 days they had to stand up that shelter. I'd also like to say that statewide, hotels are being used as wellness shelters currently, and the outcomes from people who are staying in those hotel-run wellness shelters have better outcomes than people who have been staying in the congregate care shelters that have been in existence for years in the state because they are safer, they are better fed, and better cared for. I'd also like to talk a little bit about the state level response that has been mentioned in several points, that the Statewide Homeless Council and Maine Housing have hired community something housing, it's a national agency, to design a statewide system redesign for all of the homeless services in the state. Part of that is looking at how to break the state up into service areas that can have local control and autonomy and decision-making about how they respond to the homeless crisis in the state. And they are on the verge of making a decision to use the 8 DHHS current service zones to do that in conjunction with the Statewide Homeless Council's 3 regions, so that funding, resources, and local control would be utilized to implement a response to the homeless crisis. So no one municipality would be responsible for that, because currently the three statewide homeless council regions are focused around, as you know, Portland, Lewiston, and Augusta. This would break those into smaller components and have more local control and accountability across communities that share the responsibility for that. And there would be funding that comes with that. And then I'd also like to talk a little bit about the cost of unsheltered people living in communities to the actual community. Local emergency services are currently responding to people who are unsheltered, whether they're staying in a campsite or they're in the parking garages or wherever they may be. And the cost to the community for each of those service calls, it's usually a service call that will involve law enforcement and emergency medical services, possibly with an overnight in a jail cell or in an emergency room, are extremely high. And there have been multiple studies in the state that show for someone who is comorbid for mental illness and substance abuse disorder, that costs the community upwards of $100,000 a year to respond to them using emergency services. And it costs about $15,000 a year to provide that person with shelter and housing.
All right, thank you. Thank you very much, sir.
You're welcome. And I'd also just like to close by saying that providing shelter for people who are unhoused is the compassionate response here. Every year, New Beginnings sponsors the homeless vigil on the shortest night of the year, and we read off the names of the people who have died on the streets of Lewiston.
All right.
And I don't want to read off any more names.
All right, thank you, sir.
You're welcome.
Mayor,
Yes.
just quickly interject. I did receive another email from Mr. John Connor, who stated that his questions were emailed prior to the workshop. The workshops have answered, I believe, the majority, if not all of his questions, and he plans to make public comment here through Zoom at some point. So there's no need for us to read off those questions or answer them at this point.
All right, thank you so much. If we could bring in Mr. David Singer. Good evening. Good evening, sir. Welcome and appreciate you attending.
Mine is the form of a question. This is for CBS 13. I just had two questions. And again, if you want to.
Yeah, hold on a sec, sir. Yeah, so you can ask that question. We're not going to answer it right here during our meeting, but possibly our city administrator will address it with a quick email or something to you, depending on what that question is. But go ahead.
Yes, two questions, and I will follow up an email that they can just address it there. The costs from the Maine Housing Fund that would go toward this project, and specifically which hotel is being used in Ward 7. That's all.
Right.
Thank you.
Thank you, sir. Mr. Connor, please.
All right, can you hear me, sir?
Yes, sir. Thank you. Go ahead.
Excellent, thank you. Thank you very much, Mr. Mayor and councilors and city staff. My comment tonight is neither in favor of nor against a temporary shelter. My comment tonight speaks to the lack of transparency and what feels like an active attempt to stifle public interaction. I'm not saying that is exactly what happened. I'm just letting the council know what the perception is. It seems that the city and community concepts have gone to great lengths to not mention the specific hotel in question for the homeless shelter. I can only surmise that this was at the request of the hotel staff in fear of loss of business from any fallout that may have come from public. If the council purposefully withheld the name of the hotel that is about to take taxpayer money in order to ensure little to no public backlash to that hotel, it should be a clear indicator to the council that this issue needs further public debate. Finally, my biggest concern is a contractual concern. What happens if the hotel in question does encounter public backlash and suffers economically? Is the contract for the shelter going to cover full occupancy? If the hotel comes to the city or CCI with a demand for more money due to profit losses from a lack of non-shelter business, what is the city's contingency plan for that? What happens if the hotel comes to the city and says we have to close our doors because we're not getting enough business? I trust that much smarter people than I will take all of these contingencies into account when the contract is ultimately agreed to. I appreciate all of your time. Thank you very much, everyone.
All right, thank you, sir. Are there any other comments from the public? If so, you just need to raise your hand. Okay, seeing none, back to the council. Councilor Clement.
Thank you, Mr. Mayor. Very briefly, personal feelings aside, I'm not about to vote on this with any personal feeling I have one way or the other. My vote tonight will be representative of what has been communicated to me by constituents of mine, and they do not want to see this happen. I can't go against their wishes, irregardless of my feelings. I recognize the need. I see several problems with this particular venture, but I'm not going to go into that any further. My no vote will take care of that. I only hope others can look at this thing. I think the gentleman that just spoke and talked about a lack of transparency, it's very evident there's been a lack of transparency on this issue. And I think the public at large, if they had an opportunity to discuss this and weigh in on it, we might have a much different sentiment than what has come forth tonight. Thank you.
Thank you. Councilor Ray.
Thank you, Mr. Mayor. I wanted to reflect on the fact that this is such an opportunity that's being brought forward for partnership with the city with no direct funding ask of the city. If we turn down this solution, homelessness doesn't go away. Unhoused populations don't just go away if you try to forget about them. There are people with real needs in this community and in surrounding communities. And I think the work that was done at the Armory has led to decisions being made on experience now. And I think the expectations will be set very clearly at the onset of the shelter should it pass tonight. And I'm in full support of continuing this partnership with these folks. I think right now is the opportunity for folks in the public to have this conversation. And I think a lot of it has been overshadowed with other news in the past couple of weeks. I think the idea first came to us a couple of weeks ago, and we just haven't had meetings due to the election and due to other circumstances. So I just want folks to really consider the city is being asked to give a thumbs up on this. I mean, it's a policy decision. There's not a fiscal impact to our yearly budget cycle. It's not an out of budget request. And so I hope folks will join me in supporting this and supporting those who need some help at this time.
Okay, thank you. Councilor Jensen.
Thank you, Mr. Mayor. I guess I'll start off by saying this is not an easy decision for me. I'll kind of jump back to what you've probably talked about. I'll do the 11th time for you. There are issues that the state is just not taking care of that they should have. We have to remember that we are Mainers before we are residents of our cities first. We are fellow Mainers together, and some problems need to be dealt at the state level. It's not fair for a state to relinquish its duty and then have those issues go to cities, and then cities like Lewiston either have to pay for them themselves or deal with the consequences. And I feel like that's what we do in Lewiston, is a lot of the decisions we make, I just don't feel like going through 3 budget cycles in the school committee and then now 1 through the city. It's very clear to me that we do not have the luxury to be compassionate as a city. When we spend money on things that are compassionate, to me, it seems like we're doing it as a way of, it's just more cost effective as a city than it is to not do anything at all. Like, it's better for our business if we take action there. And I think that's really, really unfortunate that we're in a monetary position as a city where we can't help the people that we need to help. That a lot of our actions are really to mitigate negative consequences. So as a Mainer, I'm appalled that my state government is failing to take action here. Absolutely appalled. Homelessness is a state issue and the state needs to take action. 100%. I'm just not going to waver from that. However, on the city level, we have to look at things a little bit differently. We have to understand what is our responsibility, what can we best do with the resources that we have. So keeping all that in mind together, this is not an easy decision for me. So I can say for sure that I'm not in favor of a permanent shelter at this time. I could get there. I absolutely could, but this time with the information I have, I'm not there. So having this is a temporary, is obviously better for me. It makes me more supportive of it. I do have some concerns though, obviously. I mean, I view the Armory shelter as a success. There were some issues, obviously, of course, but I do view it as a success. And I think that building upon that could make an even greater success. So the big thing for me is there's just uncertainty. And at the end of the day, we're the ones approving this. So if something bad happens, who do we yell at? We yell at ourselves. We're the ones approving this. So the buck falls on us. So it's a big decision for me. So when we weigh everything, we have to weigh the uncertainties that could happen. And that goes into my consideration here. So I guess it really comes down to, do I feel comfortable enough approving this, knowing what I know? I do have some concerns as far as the money goes. No, there's nothing that we're putting into the budget asking for something for this, but it's not fair to say that taxpayers won't be paying anything, because there's going to be potential costs for police visits. We already know our police department's overworked. That's going to take time from them. No question about that. Something else is going to have to suffer as a result. There could be increase of litter. We've talked about that did happen. If litter happens, and there may be public works workers need to go and address those issues, because I talked a lot about visibility in the city. And so I'll fully expect that the litter will be cleaned up. And if public works has to do it, then we have to accept that as a city. That's a cost that we're taking on. So my expectation as a counselor, if litter does happen, public works should be addressing that and taking care of it. So just so we're clear, just from my point of view, of course, I say it as one city councilor, but I hope others can support that as well. And then also to the fact that it is possible that money could come from GA. It's not a lot. I'm not, raising the alarms over that, but to say that we couldn't spend some extra general assistance money for people coming, to Lewiston, potentially staying, that is a possibility. It's probably not going to be a huge amount if it does happen, but to say it's not possible is not true. And it's important that we talk about these things, because we need to make sure expectations are clear for the residents of our city, that they're just not going to buy into these initiatives that go on. And so public buy-in needs to happen. It doesn't matter how good a project is. If the public can't support it, it's not going to work in a democracy. So the way I look at this is, it's not exactly for Lewiston. It's for Mainers that happen to be in the Lewiston area. So when I approach this, do I think that the benefits of this will outweigh the negatives? I do. I do. And so the uncertainty I have still exists. If something bad happens, it's going to make it harder for me to sleep at night. But I've reached a decision where I'm going to support this. Again, I'm not 100% in favor of a permanent shelter at this point. It's going to take a lot for me to get there. But given that we're in a pandemic, the situation that we're in, the absolute failure by the state government to provide services that social service communities now have to take on. And don't get me started on school districts and school funding. Just weighing this all together, it's not an easy decision. And I get where people are coming from on all sides of this. So I'm going to support it, but I just want people to know that it's not an easy decision. So thank you.
All right, thank you. Councilor Jelinas.
Thank you, Mr. Mayor. I am an advocate for homeless people, no question. And I am appreciative of the public discussion that occurred tonight and the opportunity that we gave people to say what they wanted to say. The one concern that I have about this isn't so much about, whether or not we do a temporary homeless shelter. The concern that I have is, we've talked about the importance of public discussion, yes, but, the complete transparency piece for me is a little troublesome. And I feel like we owe our community more information in terms of where, I feel like it's been secret squirrel. We can't say exactly. And I'm curious, as I hear other people on the call talk about other hotels having done this successfully. So, was it withheld from the public in that community? Was it shared? Was it, so for me, it's more that that doesn't feel right. And that's the concern that I have about tonight's discussion.
So that's a good point. And, ever since Mr. Connor's comments, I do believe we probably should be announcing this tonight, because we've been asked. We did not want to broadcast it because it wasn't a contract between the city of Lewiston and this organization. It was a contract between the state, Maine Housing, and Community Concepts. But it is out there. I mean, it's been on social media. So I'll clearly state that it's the Ramada that's negotiating, and because I think we've been asked, and I think once that happened, regardless if it was a reporter or not, I think we have an obligation to share that. So, and I appreciate your comments, Councilor Jelinas, in that specific area. Anything else, Councilor Jelinas?
No, thank you.
Thanks. Councilor Pettingill?
Thank you, Mr. Mayor. You know, and myself, much like Councilor Jensen, I come to this from a place that I'm torn. Most of the people that I've talked to about it, I think feel the same way. They don't want to see people out in the elements in the wintertime. This is Maine. It's not an enviable position for anybody to be out there in, you know, negative 20-degree weather without any sort of shelter to protect yourself. But they're not really sure if this is the right avenue to do that. I support people not being out in the elements, and this is a temporary shelter, so I'm okay with this. I'm not in support of a permanent shelter, but that's not the issue on the table. And then just to go back to sort of some comments that were made, I'm glad that we were able to you know, identify the place that this is going. And then it's important to, you know, keep in mind too, that the decisions that have put, you know, us and the city in a position that we're not able to really take care of those people that call Lewiston home. And we have to really make those tough decisions of whether it's, you know, this or that when it comes down to budget season, and how much of a struggle that really is. And it's unfortunate that for new counselors on this council, they didn't get to really experience how fun it is to go through a budget meeting in person. You know, as some of us have done before on prior councils. That's a joke, because it's not really fun. But just how much of a process that is, where you really have to weigh the outcomes and juggle everything that goes through with that. So we do have to be cognizant of when we're spending the money and the long-term effects that has in creating the culture that builds and not being able to support those people. So when we talk about supporting people and supporting our communities, we really need to take a look at the whole picture and make sure that we're able to sustain these programs and be able to take care of the people, so that way it's really not a Band-Aid, and we really are doing those right things for the right reasons, because you know, that's what it's all about. Thank you.
Thank you. Councilor LaJoy?
Thank you, Mr. Mayor. I guess I'm going to echo the same thing that Councilor Pettingill has stated, as well as others. There is a grave concern there because, number one, it's not absolutely a new situation because we experienced it in March. But also, I think that the individuals that created or provided that ability in March and April, if I remember correctly, at the Armory, learned quite a bit from their experience and therefore applied that to the planning into this particular situation. As a member of another, how can I say, building, if you will, within the city, I had occasions to address or have the LPD, Lewiston Police Department, respond to the property to ask a homeless well, actually, there was 5 homeless individuals in front of the building. I felt bad by doing that. However, I was getting calls from individuals involved in that particular area of the building, if you will. I kind of like to see this particular situation come about where everyone, those in need, and hopefully the ones that are in extreme need will have a place to be at, and especially be out of the cold, and so on. So I do have concerns, but I also have a lot of faith in the individuals that are moving forward to try to put this particular situation together. So as many concerns as I do have, and of course I received some of my constituents that would not like to see it in their area. But needless to say, for a temporary situation, I'll be going along with the vote in a positive manner. Thank you.
Thank you. Councilor Clement.
Thank you, Mr. Mayor. Just inquiring if perhaps members of the council would consider tabling this to a time specific in order that the public might have a chance to enter into the discussion, given the concerns that at least 2 of my colleagues have had about the transparency. I don't think that'd be unreasonable. We have a meeting, I believe, scheduled a week from tonight. Given some attendant publicity from this, if nobody else rings in, then so be it. But I would hate to see come tomorrow, people say, we weren't aware of this and we didn't have a chance to affect any comment on it. So therefore, I would ask if there was any sentiment to perhaps placing this on the table to a time specific and then addressing it at next week's meeting.
I'll give a moment in case any counselor agrees with that.
If there's that sentiment, I'd make a motion, but if not, then it'd be fruitless and we'd just be wasting time.
Okay, I'm not seeing any interest at this point, Councilor Clement.
Thank you.
All right, Councilor Ray.
As we're having this discussion, a question came to mind, and given kind of the newness of our administrative team, I'm not sure that it can be readily answered at this moment, but we have examples within the city of shelters that have been stood up at some point in time. And so I'm just curious what the public process looked like for those institutions, if we have prior knowledge of that, trying to understand if this is an equivalent process, if we are not meeting the transparency needs. I think we've answered some of the questions here tonight, but I'm just curious if there's a relevant time period we could refer to.
So in terms of the process, in response to that, in terms of the process of other shelters went through to get established, I think is what you're asking. We're not aware of that. I did try to find out a little bit, just very preliminary kind of search and trying to understand if there was any kind of history on that, but I have not been able to discover any real formal process or public discussion process on other shelters.
Okay.
I've been here, they've been established, long before I was here. So.
Yeah, and then just given the temporary nature of this and the imminent need of winter coming, not to quote everyone's favorite HBO show, but I just think this is an entirely different process. It is emergent as a need. And I think all of us, when the shelter closed in July, were hopeful that we wouldn't have to have this discussion again, that folks would have worked through case management and achieved housing solutions or other solutions that they needed. B, the pandemic would not be continuing and surging. And I think C, that there would be a variety of solutions to choose from. I think, no disrespect to any colleague who might oppose this, but I'm interested to hear other solutions, because again, this is not something, this isn't a solve. It is a solution to this imminent need. And so again, I hope folks will join me in pushing this forward and learning more from this experience. And I look forward to future discussions about how we achieve what we want to achieve.
It almost sounded like you were asking me to say again my thoughts on but I won't. I'll hold on. I do want to touch base on the public, the transparency. One, this is an issue that legally the city administrator could have signed off and didn't require a municipal officer vote. But through discussion with council members, Dennis's strong opinion that this needed to go to a city council meeting, we're here tonight. I've gotten calls from constituents well aware of this discussion tonight, and I've seen it posted on social media. I do believe we did what, one, municipalities can always try to do better at transparency and make sure the public's notified of issues coming before us. And of course, we should strive for that. But I do believe that there was just as much public notification with this subject as there was every other difficult or non-difficult subject that this council has dealt with since being a city council. So, I'm confident that with a straight face, we can say we did take this to a public discussion when we didn't have to. And that, as far as I know, many of the public is well aware of this discussion. Again, the idea of us not mentioning the location specifically, I think I've shared my thoughts on that. All right. I don't see any other councilors raising their hands, and we're not going back to the public at this point. So with that, I'll call the roll.
Okay, Mr. Mayor, Councilor Clement does have his hand up.
Okay, Councilor Clement.
Just looking over the packet, the language in here would indicate that we can terminate this agreement with 15 days notice if we so see fit in the future. Is that what I'm to understand on this?
Yes, sir. That is what you're reading. Yes.
Thank you.
Okay, thank you. And seeing nothing else, call the roll, please.
Sure. Councilor from Ward 1?
Yes.
Ward 2?
Yes.
Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
No.
Ward 7?
And take your mic off, Stephanie. You're muted.
Yes.
All right,
Thank you. Motion passes by a vote of 6-1.
All right, thank you. Agenda item number 2, please.
Item number 2, resolve extending the waiving of certain fees and policies involving the public right-of-way and municipally owned property, and continue the established procedures to allow for the use of private parking areas for the purpose of assisting Lewiston organizations in implementing social distancing. Requested action: to approve the resolve extending the waiving of certain fees and policies involving the public right-of-way and municipally owned property, and continue the established procedures to allow for the use of private parking areas for the purpose of assisting Lewiston organizations in implementing social distancing.
So moved.
Second the motion.
Okay, moved by Councilor Jelinas, seconded by, I believe, first Councilor Jensen. Okay. Question. Oh, Dennis, did you want to just quick?
Sure. I can give a very quick overview. You may recall this, Council, May 19th of this year, you actually took action on this resolve to create this opportunity, extending the waiver or waiving the fees, certain fees. We had a city committee, staff committee made up that's outlined in the resolve as well, that reviewed these requests and worked with businesses to utilize this option for outdoor seating. The original resolve was tied to a November 1st deadline, or when social distancing requirements were lifted, whichever one came first. Obviously, November 1st has passed, and obviously social distancing requirements have not been lifted. So what the recommendation here, what you have coming for you is extending this and having it coincide with the governor's state of emergency when that is lifted. And I think that's it.
All right, thank you. Any questions or comments, Councilor Ray?
Thank you, Mr. Mayor. I was just wondering about the utilization of this. Could you just give us some sort of ballpark number of businesses or organizations that took advantage of this?
I don't have a specific ballpark number, unfortunately, Councilor, but I would say that, just evidenced by, I think parts of our city and different restaurants that we've seen, there's been quite a few. And I know we did receive a pretty good number initially. I was part of that committee that reviewed these. And I just shout out to staff, and they turned those around very quickly in response to that. So I know we went through quite a few applications and different scenarios that worked with businesses. But specific number, don't have it, but I know it was several that we were able to successfully help with this.
Okay, and you wouldn't expect new applications to come in. It would be an extension of current ones or also an open invitation for application?
I think a little of all three, I guess, is if there's certainly a business that sees an opportunity that has not come forward, we would encourage them to do this. The whole point of this, we want to work with them on that, to see that. I could see potentially some businesses being that we're getting into the winter months, if that changes some of their layout or some of their plans, they may look to resubmit to us maybe a different layout or different idea. So I think that be all three of what you outlined there, potentially would be open to hearing those.
Great, thank you.
Thank you. Councilor Pettingill.
The wrong place for the mute button. Curious if there is would be any agreement to removing the expiration of this and just rolling forward with it.
The only, if I could just comment on that, there is some, for instance, there's closing of sidewalks in this, so it's a little, it's not just putting, seats on the sidewalk in that. So I would just caution on that, I guess extending this as it is would be, I think would require some additional review of staff and probably some additional feedback. But in terms of the discussion around it or looking at a variation of this, I think staff would be supportive of reviewing that. Just throw that out there.
I would be very supportive of that. And I think the brief conversation I had with Dennis about this subject, that was the first thing I said, is we really should think about eliminating and letting our businesses use the areas they need. But I do believe it would require a broader discussion, but I would support that. Any other questions from councilors? If not, to the public. Back to the council. Call the roll, please.
Counselor from Ward 1,
Yes.
Ward 2,
Yes.
Ward 3,
Yes.
Ward 4,
Yes.
Ward 5,
Yes.
Ward 6,
Yes.
and Ward 7.
Yes.
Motion passed by a vote of 7-0.
I'll entertain a motion.
Move to
Motion to
adjourn.
adjourn.
Moved by Councilor Jensen, seconded by Councilor Ray. Call the roll.
Counselor from Ward 1,
Yes.
Ward 2,
Yes.
Ward 3,
Yes.
Ward 4,
Yes.
Ward 5,
Yes.
Ward 6,
Yes.
and Ward 7.
Yes.
Motion passed by a vote of 7-0.
Okay, thank you all, city councilors, staff, and most importantly to the public for attending this meeting tonight. Thank you.